I know
Thank
there are a
you.
lot of people who a Board of Health meeting to order. Pursuant to Governor Baker's March 12th, 2020 order, suspending certain provisions of the open meeting law, and the governor's March 15th, 2020 order imposing strict limitation on the number of people that may gather in one place, this meeting of the Westborough Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the Town of Westborough's website at town.westborough.ma.us. For this meeting, members of the public wishing to watch the meeting may do so in the following manner: westboroughTV.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording transcript or other comprehensive record of proceedings as soon as possible after the meeting. Okay. So if we could start with the minutes of the January 19th, 2021 meeting, please.
I've got one question.
Go ahead.
New business, there's a section where we talk about the Department of Elementary and Secondary Education, DESE. I think it's the abbreviation is wrong. It's DESE, not ESC.
You are correct. Paula, you got that?
Other than that, I'd like to make a motion to accept the minutes from the January 19th, 2011 meeting.
I'll second that.
Okay. Paula, can you confirm you have Nathan's correction?
Yep, all set.
Thanks. Okay. I will take roll call vote. All in favor, Nathan?
Walsh, yes.
Syed?
Yes.
And Alan, yes. Okay. So next item on business is the director's report for January 2021. Any comments or questions?
I actually wanted to hear from Steve. He was mentioning that the request from the public determining the legal status of existing multifamily structures in town. If you could just give a little bit more background on what that means, like what type of things are people asking?
Well, so what happens is these 2 or 3 family units will go on sale, and the prospective buyer will want to know, hey, are these legally 2 or 3 apartment buildings? And a lot of things happen throughout time. If someone has held on to these properties for a while, maybe they've done stuff with or without permits, with or without approval, that sort of thing. So we wanted to develop some kind of process where we could look back and say, okay, maybe we do have records on that type of thing, maybe we don't, and try to figure out what the best way going forward is. So that's kind of in a nutshell what we were trying to do.
And do we have housing code that's related to like certifying that a dwelling is actually a multifamily unit?
No, I mean, obviously there's minimum standards to any apartment, but the one thing that would be in our realm would be if the house or dwelling was on a septic system. Obviously, then there's design criteria for the bedrooms, that sort of thing. Okay. But other than that, it's just as long as it meets the minimum standard.
Yeah. Zoning, and then there's like health and safety, and I would imagine that we're only thinking about health and safety.
Correct.
Steve, you noted on your report that you conducted interviews for the health inspector's position. Could you update us on the status of that?
Well, thank you for asking. So as everyone knows, Erin took another job at the end of December. We had interviews in January, and we have hired someone, Maria, who is actually on the call right now. We asked her to give a few minutes of her time, as she is not on our payroll yet. But I did want to welcome her to the Westborough Board of Health. She will start on March 8th. Just kind of want to give you guys a heads up that she has numerous years of experience working in Framingham. especially with customer service, those sorts of things. So we really do think she'll be an asset coming in to the health department and helping us, keep going on with, everything that we're doing. So I don't know if Maria, if you wanted to say a word or two or not, but putting you on the spot, of course. But
That's okay. That's okay. Thank you. So I come from Framingham. I was with Framingham for 15 years. So I definitely have knowledge of the health department and how it works. And I'm excited to join the team.
Well, welcome. We're happy to have you with us.
Thank you.
Welcome.
Any questions from either Dr. Walsh or Dr. Hashmi?
No, just welcome, but welcome to the frying pan, I guess, or the fire. Which one or the other?
On that such upbeat note, I am going to make a recommendation that we, or a motion that we approve the director's report for January 21.
I'll second it, but I just had a one or two comments, quick comments. Steve?
yes, I'm here.
So thank you again. Thanks for the vaccination. Do you want to talk about how we didn't get the vaccines now, or do you want to talk about it later at the end of the day? What do you want to do?
Yeah, I think it's better. I think on the agenda, we did have a thing at 6:45 for a general COVID discussion, so probably more appropriate to do it then.
Okay. All right.
Before we wrap up the director's report, I just want to say thank you to Maria for taking a few minutes rather, to spend some time with us. And you are welcome. It's going to be a fascinating meeting. But if you have prior commitments, if you have prior commitments that take you away, we appreciate you at least stopping in and saying hello. And we look forward to seeing you next month.
Absolutely. Take care. Thank you. Bye.
Yep. Okay. Do we have a motion to accept the director's report? I think, Nathan, you made a motion?
Yes.
I seconded it.
Okay. Roll call vote. Dr. Walsh?
Walsh, yes.
Dr. Hashmi?
Yes.
Dr. Ehrlich, yes. Okay. Sanitarians report. I had a quick question for you, Ray. You start out with the housing and the food, sort of under a general heading of nuisance complaints, but those the nuisance part doesn't seem to come till later. Any comment about your organization?
Yeah, I put it on last month and I didn't change the title.
All right, maybe you can just reorganize that for the final version.
The housing fits under nuisance. The food is the only two I can pull out of there and change that to a different heading.
Okay.
I didn't even notice that. They weren't complaints. They were just two new, the movie set and the temporary trailer. That's it.
Okay.
And so Dr. Ehrlich, are we taking questions on the report?
Absolutely.
So Ray, I know last year we had the issues with the with the pools, and do you foresee any problems this year by any chance?
No, I sent out all the applications early.
Okay.
Some have gotten them in. I put that we don't want them paying for their hot tubs because right now hot tubs are still not allowed. So I didn't want people paying for those up front and then us having to refund money. So we're going to go step by step. I'm hoping to get out on the year-round pools in the next week or so, get out and do an inspection on those. And then the others won't open till May. So I'll have time by then to get things done.
Okay. And sorry, am I allowed to ask?
Keep going. Keep going.
Okay. And I know that, I know Maria is not going to be starting for a while. So this is, I guess, a question for both Ray and Steve. What do you think? I mean, how much of an impact do you think this will have on our restaurant impact inspections? Go ahead.
Well, we haven't had anybody for a month. Erin left December 31st, so I've been doing complaints only. Haven't gotten out on any restaurant inspections. We'll do the best we can, but since COVID hit, we had to put restaurants and other stuff, move them to the side, and only do the ones that were really the ones that are struggling, or our favorites, and get out and do those.
Okay.
So that's kind of how we're going to do it. And when Maria gets here, I will train her. I did work with her in Framingham for 2 years when I was out there, so I know I can train her, and I'll get her out on the restaurants as soon as I can get her out there.
Great, thank you.
So to that extent, I've asked Steve to have this on the agenda later regarding masks, but my question for you is on the COVID-related complaints that you had multiple of. Are those all mask-related, or are there other aspects that?
No, there was some with social distancing, but yeah, I'd say every one of them had a little component about masks.
Okay.
I
All
had
right.
another call today about 7-Eleven and a couple other small places in town, but we get out on them, we call them, and that's kind of what we can do right now.
All right. So I'm going to want to talk about this more when there's an agenda item related to this. So I'm going to defer additional comments till then.
I might jump in if I can.
Please.
And maybe this is what you wanted to defer, but at least 3 of those places are places that are recurring, coming up often. And I think last month when we had talked about it, we said that we were going to go ahead and do the issue fines. And I was just wondering if that was still the plan, whether we had issued fines or whether these are, we haven't done that yet.
Well, we have not for those facilities. Last month, I think our main thing was not the New York Deli, where we've had numerous complaints of, although those have stopped. All of a sudden, those stopped.
Okay. They're still on this month's list here, so.
No, we haven't. I'm not sure. Are they reoccurring ones, Ray, that you could see off the top of your head?
Well, we have New York Deli was on January 3rd, so that was before the last meeting. And then Meiningers was the one the letter we got from the state. And then I have
also come up
Toyota, Westborough Toyota, but one of those was a complaint. But when they looked at it on film and he showed me the clips, there was nothing there.
Oh, okay.
Roach Brothers was new. Bass and Badminton, there was 2 complaints this month on them. That's something I've handled. Other than that, I don't. They're all. It's going to continue. I don't see it. We're getting calls like, "Oh, I walked in behind a person at Stop and Shop and they weren't wearing a mask, and when I told them they should wear one, they yelled at me."
I see. So it's not so much the management as it is the customers. And
No. And the other thing too is we have to realize too, a lot of these companies are national brands, and 7-Eleven, who was the other? There's a few others. The Shell station on Route 9. They are told by their corporate company entities to put signs on the door, signs inside, and not to say anything to the customers. Because maybe not here in Westborough, Massachusetts, but there are other places in the country where when they were talking to people, they were getting attacked. They were getting things thrown at them. We actually had a gentleman throw a hot pizza on the Mass Pike at Papagino's back in June. The girl gave him his pizza and she said, "Sir, you do have to wear a mask inside." And he threw the pizza right back at her face. So companies are trying to keep their people protected. So I understand that, but I want to make sure the signage is there, number one, and only the managers are making the comments for people to wear masks. We don't want to see anybody get hurt.
So I agree with that. And actually, Nathan, my sentiment was actually in a different direction, which is, we have limited resources. So that's one thing. And I'm not sure that we're going to be able to be responding to every time someone sees a situation where there isn't a mask, that we're going to be able to have somebody run out. As the situation of our staffing evolves, we're going to be more and more pressed to prioritize what's most important. And I think, I want to emphasize the educational role that our department plays. And the other thing that I'm very concerned about is, and this is with the finding, and we can have a more extended discussion, but, the most, when you look at what's the biggest impact on trying to stem the spread, in my opinion, it's aggressive contact tracing. And for us to be effective at that, we need to be able to work cooperatively with the public at large. And I don't want us to be viewed in an antagonistic or punitive fashion that, we're out punishing people. We need their cooperation. We have enough trouble as it is getting people to trust us and cooperate with us. So you can ponder that. We'll have a more lengthy discussion when it's on the agenda. Okay. And it's now 5:45, so we will move on to discussion about the situation with the schools. 1 second. Okay, so the title of this section is a preliminary discussion for parameters to resume in-person learning in the schools. And there's been a lot of communications to the board in preparation for this meeting. Superintendent Bach sent in materials for us to review. I hope people have had the chance to review them, although I'm certainly going to give her the opportunity to present her ideas on this. We've also received letters and opinions from members of the public, some of whom are on this call, and they will have an opportunity to express themselves and respond to things. So the general, because many people who are on this call may not be familiar with how we work, I'll just make it clear. The way it'll work, generally, someone such as Steve lays out the issues for whatever we're going to be discussing. Amber will then have a chance to present what she would like to present, and then there'll be some general initial questions from the board members. Following that, we will then open up to the public, and everyone will get a chance to have their say and responses as appropriate. If you are speaking for the first time, please give your name and your address for Paula for the purposes of the minutes. With that said, yes, go ahead, Syed.
I'm just wondering, sir, that, as we're going to be deliberating on this, would it be helpful if we just had a little tweak that Ms. Bach can present her stuff, and then maybe we can hear from the members of the public, and then maybe after that will allow us to have a much more informed discussion amongst ourselves as members of the board? What would you think?
I'm not opposed to that, although I would. All I'm saying is I would probably give the board first chance just to ask questions. I'm not suggesting we deliberate before we hear from people of the public, but to ask questions regarding the plan that is going to be presented.
Okay.
All right. So, Steve, I don't know if you want to lay out anything in advance, or we can start right ahead with Amber.
I think it's pretty self-explanatory. So in the interest of time, I'll just kind of say, give it to Amber, I guess, as far as any presentation she has or comments she wants to make.
But I will interject one comment on my own before she gets started, which is that for those who are unaware, there have been good collaboration between the school department and the Board of Health. I know Steve is talking with the nurses there on a regular basis, and I have participated in conversations with Steve with the school representatives, including Amber, around these issues. So there has been dialogue up till this point. And with that said, Amber, please proceed.
All right. Thank you. I also invited Daniel Mayer, the assistant superintendent. He's on the call as well. I feel like the two of us represent kind of a branch of some of this work, and so together can listen better and answer questions. And so thank you for making time for us, and also I'm pleased to see parents here and welcome the opportunity for them to speak as well, and defer to you, Dr. Ehrlich, as chair, to guide the conversation if it seems purposeful to pause. I'll let you shepherd that as best. I think our purpose tonight, it's going to be best if I can share my screen, if you're all right with that. And
yes, please.
I just tried to put together some general, let me just pull it up here. All right, let's see if I can get this right. Might take me a second. We've really not been in Google here, so I apologize if I mess up. Can you see the school update and discussion slide?
Yes.
Okay, so what I want to do is, let me get a little bit bigger here. All right, is that better? Is that better?
It's good.
All right, so we try to, one of the things I really value about the opportunity to come and work with you as a board is to get consult and guidance and ideas from you and feedback on the direction of our planning. And then as we move into implementation, historically, we've stayed in regular contact through our nurse leader and Steve, and mostly the chair, Dr. Ehrlich, to check on confirmation of our direction and to make sure that our implementations look good. I think what we want to do tonight is what we've done typically on a couple different occasions, which is to give you an open discussion opportunity and to keep our comments brief and to work off of the direction of kind of what you're hoping to hear from us. And that would allow for more input from people at your guidance. So what I thought we would try to accomplish tonight was I'm going to do a quick update. I think we've stayed in close contact, but it's helpful to set a little bit of context for the update of our current conditions and how we're currently functioning and where we are with regard to our numbers in terms of COVID cases, and a little bit about just kind of our current practice. I think then I want to look at the updated guidance that's been released and talk a little bit about how we leverage that guidance to continue to make decisions working with you. We'll look at the CDC new release. We'll look at the transportation release. And I then, there's some pool testing data that I sent that I have linked in this particular slide, which I'll then share with you after this. We'll talk a little bit about pool testing. And then I'd like to talk about planning for more in-person learning. Currently we are in person, and the core of the discussion is around the desire for more in person. And I think it's important that we emphasize that we have been open since the start of school, and that the hybrid model has served getting us to a place to be able to move forward, to check our protocols, and to provide in-person instruction for those families who selected it. And the core of this next phase of discussion is around the recognition of the ongoing learning of the data about what we know about how schools can operate safely, what we know about the current testing situations, as well as health in Westborough, and what that means for us as a district in terms of opportunities to increase more in-person learning. I'll talk a little bit about the timeline, which is what I sent you, and has some links in it, but it's more a general informative anchor for the discussion. And we'll talk about the options that we're working on developing. Currently, we have a survey out as well. Now Daniel can give some highlight points on that. And there's another survey that will go out probably tomorrow or Thursday, most likely, to kindergarten parents for some more targeted specific data from them. And then I'll open it up for conversation. All right, so that's kind of what I think we want to try to accomplish together. And Daniel will hop in as needed and contribute between the two of us. So current practice, as I said, we opened with a phased on-time opening this year, and we opened up pre-K to 12. I think one of the important distinctions for Westborough was that we planned and navigated this as a whole district and didn't split our district into different grade levels in order to get open, with some opening and some not. We've seen a lot of districts that have struggled with getting their high schools open and getting their middle schools open. There are many districts that are continuing to struggle with getting open at all. We really focused on working on a model that would allow us to bring back pre-K-12 in a cohesive model. And certainly all districts, as we know, have made a range of decisions about how to best do that based upon the confinements of their districts, their buildings, their enrollment, and all of those types of things. And for us, it was the phased start with hybrid. Currently, we're providing a hybrid and remote learning options for families. We had a mid-year option for people to switch, and then our current survey asks how people are feeling now as we look at some potential for some other changes. We're serving about 2,800 students in the hybrid model, and the model has changed in kind of phases. From October to December, we worked to provide more in-person connections, looking towards the data that we had gotten from families and from students and from teachers around kind of things that were happening on the ground with our hybrid-based students, and then also some of the tweaks we made to our remote lesson structures as well. So the adjustments of that model, while they mostly focused in the fall on the internal and visible, which was working with our faculty to iron out all of our safety protocol implementations, I think there's kind of the visible front of the piece of what parents could see in terms of updates we provided that would say, we're going to try to add more FaceTime in the away day, or we're tweaking this piece of posting lessons differently, or this is how we're going to change something that might go on for children instructionally. I think October to December, on the interior of the school side for faculty, we were spending a tremendous amount of time working on ironing out our protocols, what cleaning products we were going to be using that met the needs of safety for students and followed the criteria of the CDC. So October to December was pretty volatile, and then began to stabilize probably around middle to end of November, and we felt we could go out and check in with parents and then use that data to update through December more extensively. We added more content time and resources and support specifically for SEL social emotional learning and mental health. There was a big call in the early fall for us to alleviate too much work, specifically at Gibbons in high school and some at Mill Pond, where parents, I think, and all of us were feeling kind of overwhelmed by the implementation of the model. And many people felt that the workload was too extensive. So one of our social emotional learning interventions was to roll back work on the away days and to stabilize more interactive, directed social emotional kind of content time with students, and then to activate a second tier of calling and connecting, utilizing all of our guidance counselors and adjustment counselors and a range of other support services to make sure that students and families were getting connections if they were articulating their struggle or teachers were seeing it. Then that brings us to December, and from December to now, when we felt that we had the learning model implementation and some of the social emotional framework supports in place, we were able to look at December, what could change now. And we started developing some internal discussions, specifically around kindergarten in kind of middle of December at the leadership team, looking for ways that we might return more students where feasible. There's two core groups we recognize have had highly impacted learning, our first graders and our kindergartners because of age and never really having had the schooling opportunity that other students have had the advantage of using as a framework. And our first graders who had a fragmented kindergarten and then a fragmented first grade, really feeling that impact was substantial for them. So we started there in terms of the intervention discussions, first with K as a prototype and pilot to be able to articulate and visualize to teachers how we might stage forward returning more students. So that kind of captures some of the practice of what our life has been in a very tight synopsis since we found a way to open, since we navigated working collaboratively with all our working groups and were able to open school in the fall. The backdrop of that has always been tracking our COVID numbers and communicating on a regular basis any changes to a COVID case or towards building safety, and a regular series of announcements, which was part of our kind of settled negotiation plan when we planned to open. So currently to date across district, we've had 148 cases. All of those cases, they've kind of bell curved across the schools with higher caseloads at Mill Pond and high school as our two largest schools, and then Gibbons, followed by a smaller bell curve of the three elementary schools. But certainly it's somewhat proportional to the size of the school, and we have had cases in all schools, the smallest case impact being the WAC, the Early Childhood Center, where we had 3 adult cases and no student cases. In the total package of those case outbreaks that were identified, we've had 3 potential in-school transmissions, one in the classroom where we thought we were developing a cluster of impact cases at Mill Pond, and we actually closed that classroom for a week in order to break the cycle. Worked very collaboratively, of course, with Dr. Ehrlich to get guidance on how to best do that with Steve, and we're able to move forward, I think, very successfully to stabilize safety procedures and see that we continued moving forward with the protocols we're using. So I think that captures for you kind of what life looks like on the ground for us. Daniel, I don't know if you have anything else you want to contribute before I move off of our current life.
Are we allowed to ask questions, Dr. Ehrlich, on these?
I would say, sure. I was hoping we may need to move a little more quickly through your material, Amber.
Sure.
So, Daniel, unless you have something really on point.
Okay.
Okay.
Go ahead,
All right.
Amber.
All right.
So I'll soldier forward, so then we won't waste time on what we're currently doing, but put the focus of our questions preferably on what we're going to do.
Yeah. Syed, do you wish to ask something about the current data, or is it more forward-looking?
Yeah, I just wanted to just to highlight the fact that of the 148 cases, do we know how many of those needed to be hospitalized, or they just needed to be like quarantined at home? Do we have any of that data?
I would say that data would have to be, I mean, we could inquire and send it to you later. I would have to ask the nurses for, some specific data.
Well, I think Ray is raising his hand. It's muted. Ray, you know the answer to that?
Just from tracking all the students, I had no students, I believe, under the age of 14 that had gone into the hospitals, and I don't think anybody in the high school had gone to the hospital. I could be wrong, but from my recollection, I track all the hospital cases, and Steve does too, and I don't believe we had one at that age group. Steve,
Yeah.
if you want to.
The only outliers would be if they were kids that aren't from Westborough. Obviously we wouldn't have that data, or if the teachers weren't from Westborough, we may not know that data. So, but
As far as
overall,
we know, none of the children that were in school, as best as we can guess on the available information we have, were hospitalized. Would that be a correct statement?
Correct.
Yeah.
Okay, thank you.
And
Okay.
even further than that is that I don't think that all of these students were necessarily in the school when they were sick. I think a lot of them realized they were sick before they even got into the school system. So I think that, we have to be careful in terminology about when we say kids in school, because I don't think this is what we're talking about here.
We can come back and break that data out further. I mean, and certainly, Dr. Walsh, you kind of, as a parent, get the communications we send. So it indicates if they were in school and when they were last in school, and if we had to contact trace. So certainly we could go back and look at all 448 and, analyze how many of them had been on site. We separate out very specifically any students who are in remote, and those have been minimal cases, and we're very specific that they don't come to school at all. And there are some cases in the hybrid where, yes, we articulate in the announcement whether or not they were already in quarantine. Thank you.
Yeah, the one thing I want to just add to this discussion before you move on is that for the most part, and this is what I think some people are alluding to, most of these students have acquired, and even the adults have acquired COVID outside of the school system. But there has been some in-school transmission. It's not been a lot, and it's not been something that we haven't been able to deal with. But there's been a limited amount, and most of it is happening in the community. I think that's a fair representation.
All right.
If you want to go to your next slide.
Yep.
I just want to interject one quick thing. Just to keep, I think it's worth keeping in perspective. That's the purpose of having the hybrid model.
Sure.
It's not like, we're looking forward to opening and moving in that direction, but I think there's some people who have conflated our good practices now with thinking that therefore once we have everybody in all at once, our numbers will look the same.
All right, so I'm gonna move us forward. So the trajectory of where we are articulates our current practices, how we're sustaining our safety protocols, and the discussions leading to mid-December to now, where we started looking at what would our future bring for us as we started to get more updated guidance and data on schools. I would also articulate that we then looked at 2 separate surges in illness that also dictated rollbacks and other types of responses. And along the way, we've, tried to anticipate the pacing of what would go on with schools as we kind of read the climate of what was going on at the state. So for us, there's a couple core areas that we're going to focus on, and we'll be on this slide for the majority of our discussion before we go to the planning. For us, our anchor for medical guidance and protocol affirmation using science is to look at the CDC's guidelines, to meet with the Board of Health and affirm our direction with choice of those guidelines, to look at what DPH is saying, and to look at the guidance from DESE. DESE typically pulls from these same sources and sometimes interprets them differently. So we always refer back to running that back to the Board of Health. And in most cases, the core decision making around our actions as a district and the design of our model has pulled from the framework of what the CDC provided in the fall and summer for ways to get open. They have most recently just put out on Friday a new release, and It's currently under a first reading with us. I mean, it's a dense document. I will say that they released it as sweeping new guidance. I want to be clear that it's sweeping new guidance to direct schools that haven't been opened at all. And so the articulation of the guidance does a really nice job to reframe with clarity steps and stages to get open. And it starts to separate out very effectively. And if people read it, I think they could see what they're trying to do. They're really trying to show what they know is going on across the different districts and all the different ways that groups are open, and then to try to give them some anchor steps for then moving forward to more in-person learning. And so in looking at the first key reading of that, it adheres very strongly to the 5 key mitigation guidelines. We know those well as masks, social distancing, hand washing, cleaning protocols inclusive of ventilation, and contact tracing and quarantining being our strongest, most effective way to maintain the health and safety in schools. They are looking,
cohorting is part of which piece? Distancing?
Well, cohorting is part of distancing, but it's also, and this is my next point, distancing in their new guidelines is very closely connected to your model of delivery. And it asks that you continue to pod or to cohort or to manage students such that they can be in controlled groups so that you can return to more in-person learning. There's some interesting language that looks at, and again, I think the important point with this document is that it has support for what we're trying to do next to take steps forward. But you have to then read around the detail of, what their guidance is for you around what you might be tweaking. There is language here that says physical distancing is maintained to the greatest extent possible when other factors are in place for some implementation, if you're following a certain delivery model. So if you're doing some screening, if you're doing all these other types of things, they break it out into very kind of directed responses. And the other key thing is, if you're in a community with low transmission, then you can see some flexibility around the implementation of the physical distancing guideline. But they also then clearly articulated 6 feet as the benchmark of the best target of practice. So, I think looking at the document now, I think there's good guidance that says that given the health of Westborough, the other mitigation factors that we're very successfully implementing, that there's guidance in here indicating that we can look at some work to return more students when we can cohort and pod them. Again, it speaks heavily to elementary because you can cohort a classroom together, you can cohort a hybrid group, you can cohort a pod of a cluster of classes. It's less applicable when you look towards high school, where you have kids moving in an open schedule, than the guidelines.
Just to interrupt, I think I had brought this up back over the summer, was that in terms of podding, even at the high school level, as long as you have 20 kids that all have the exact same schedule, you could pod them together, right? There are ways that you could look at people's schedule to figure out if they've got 6 out of 7 classes together, if they've got different things like that, you could group them. And I think that's what the CDC is urging, is that you try to make your cohorts as small as possible.
Right.
Because if you just have half the school as part of your pod, that's a really big pod.
Right. No, I think your point is well taken. And they provide, when you look at the document, I think some steps forward for people to frame what it would take to schedule. And it would mean scheduling very differently. But yes, there's definitely.
And I'm not sure you could do it this year, but if we're looking at this as a long-term, multi-year phenomenon that's going on, we can certainly start thinking about it for, what happens when we plan for classes next year.
Yeah, no, I think that's an excellent point. Thank you. So the new release, it needs a careful reading. Any support you can provide in reviewing it as well. We're looking at, we'll pull the salient points.
I do have some slides that if we want to go into my interpretation of the CDC guidance, I can kind of, Alan, keep it constrained to just the CDC portion. But if you'd rather not, we can delay that too.
I would like to give you a chance, Amber. I don't know what's on your last slide, but I'd like to get a
So,
chance for people
yeah.
to start asking questions. So what I'd really like to hear from you as much in the next just a couple of minutes is,
Yeah.
you know, to the extent that you have a plan for increasing it, so what's your timeline and what are the next steps
Sure.
that you're envisioning,
Sure.
understanding that there's a lot of, the details that
Yeah.
to affect how that happens in these documents.
Sure. So, with and the other anchor things that have supported us, I mean, they just came out with new transportation updates allowing some more flexibility in busing, which gives us ways to potentially move more students. So, in looking at where we are, this is a document that we shared, which is timeline and planning for more in-person learning, and then looking towards, at some point, a reopening that feels more typical to what school, means to most families. I think I will not talk through this top. We've kind of done that. It's what I've covered, which is much of kind of what we've done along the way. You can read that for your own iteration. Let's look towards this section when we talk about next steps in terms of where we are. So our parent communication articulates a timeline that looks at, along here, communicating with families that we are beginning to look at ways to return more students with a focus initially on kindergarten. And we picked that up here where we started communicating.
Page 4 of the updated guidance on schools, correct?
I'm sharing my screen.
Right now you're sharing the slide.
Oh, wait a minute. Let me just see here. Oh, sorry, let me just open it up. I apologize.
No, I wanted to make sure that we were seeing what you thought we were seeing.
Yeah, no, thank you. I appreciate that. I think, let me just, hold on. I just have to change this.
Amber, you may need to stop sharing and then redo it.
Yeah, that's what I'm going to do. Hold on. All right. And got it. Sorry. Thank you for the nudge. All right. So you should be seeing now that roadmap. Is that better, Daniel? Okay. Thank
Yes.
you. Thank you, Dr. Walsh. So focusing, looking at next steps forward. The plan for where we are starts with a survey that had gone to parents to start to get a feel for the temperature check across all of our families and all 4,000 students for where they are with the way they're schooling their children this year, and a chance for them to give us some indication if they would like to see more in-person learning. That data is currently coming in and closes out on Friday. We began discussions with our K team leaders and our K teams to begin looking at whether or not using a 3-foot parameter of distancing in our classrooms, we could look towards returning the K hybrid students to 4 days a week. The goal in looking at that design was to have our Navy Cardinal collapse into 4 days a week and to make sure that we could provide distancing in classrooms within a 3 to 6 foot parameter. Of the, I think, 1, 2, 3, 4, like of the, how many is it? 11 classrooms, 12 classrooms, you don't have to total them up. 5 of them can provide, 4 to 6 foot distancing, and half of them will be at 3 to 4 foot distancing. So closer, but certainly manageable within the 3 foot distancing guideline of, possibility, and laid out in such a case that students still have their own kind of designated spaces, and we can still present something that looks like a kindergarten classroom and a day that feels like a kindergarten day. Our target right now is looking towards early March, which would be, within the week we come back after the remote week, we'd be looking towards sometime in those next 2 weeks, depending upon the trajectory of kind of finalizing some discussions, to get our kindergartners in 4 days a week. We have to check, and I said we'll send out a survey probably end of this week and ask them to commit to their thinking around kindergarten and whether or not they're comfortable with 4 days a week, so we could make any changes for location of students so that we could get things in kind of a finalized mode. Busing is almost done, and other criteria are set up such that we could look to take a step to returning our youngest learners. We've already returned preschoolers 4 days a week. We're not to take the steps to return kindergarten.
So Amber, I have a question for you. If about
Yeah.
half of the classrooms are a little bit smaller, or have more kids in them than the other half, and so currently right now with the Navy Cardinal cohorts, I assume that some of those crowded classrooms might already be operating, less than 6 feet. Do we see a difference in which case, which rooms we have any sort of infection in? Is it, I think that there were only a few cases, and I don't think any of our, very few cases are in school. But if it turned out they were all like in kindergarten classes that had the really tight spacing, that would be something we could learn from anecdotally, at least. If it turns out that there's no correlation, that would kind of impact our view as to how safe the protocols that we have in place are now.
Yeah, no,
I think our data's but the numbers are so low at this point. What are we talking, a handful? I mean, so no, we haven't done that analysis, but I don't think it would be particularly informative until we had higher numbers. I mean, we have like what? How many internal transmissions do we have?
Well, no, in terms of, so 2 kindergarten students, only 2 are K. The K classrooms, I think, across the whole 148, we only had 2 kindergartners. So, again, where we had to quarantine the whole class. Now you do get into that model where you're still cycling, whole classrooms through quarantining at the elementary level. So that has some pieces. So the layout initially would be then return those kindergartners, get them into a routine, show that our protocols are still, as Daniel said, ramped up to bringing in that many more students, maintain safety and health in a way that we feel really confident in, while we also then use that as a pilot for the discussions that we're having to then pressure test spaces and look at any other discussions of other grades, specifically looking at first grade in terms of the other most high priority grade in terms of urgency for a return. It also there are some compounding decisions that happen. As you return 1 grade, you're upping your numbers. As you return a 2nd grade, you have to then make other decisions on lunches. So there's there's a compounded impact as you look at adding more and more grades back in, but it's certainly not insurmountable, but they definitely require a variety of ongoing changes. This allows us to keep the 6-foot distancing at lunch, provide lunch in the model we have. So in terms of trying to be succinct around most important places where we want to, get feedback, the plan for kindergarten is taking steps forward and should be, moving towards finalization with the data we get from parents. If you look at the map just around the last piece here, you can study this to see that then at the same time you have a parallel of working groups looking at other grades, and they're asking that question in 2 lenses. Are there other ways to do more in-person learning, which might be synchronous learning that isn't in person in the building? Do we find ways to increase that as well? And do we also find ways to additionally then return more students? And those working groups will have to answer those questions stepping forward.
I want to get a chance to get into a broader discussion. I have one question came through the chat, and then one question on my own, and I want to pose those, and then Nathan, perhaps you can present some of your slides. The question that came through the chat was, the proposal is to move students to 4 in-person days, and the question is why 4, not 5? Could you address that, please?
Sure. So I would say that we discussed both and looked at the 4 and the 4.5 of that Friday half day. I'm not saying that we're opposed to looking in that direction. The teachers are also talking about it, but I think at the initial implementation, we will begin with the 4 to make sure, one, that we are finding that there's no change in illness or outbreak or any problems whatsoever. And it lets us also then nail down our busing. Those new protocols on busing are really, really new and basically went from very wide seating differentials and almost empty buses to saying collapse it down to no guidelines. I'm not fully on board with that yet. I think we need to see that we're able to transport students and move people in and out of district without any outbreaks or issues. So I wouldn't say that I'm not saying we're opposed to it, but it's not the initial first step of this particular plan.
I guess the question was about 4 days versus 5 days, and you brought up busing. I don't understand how the busing is different on a Friday than it is on a Monday through Thursday.
No. Thank you. So one of the things that happens in one of the original discussions on Friday is that when we're at a 4-day in person and we have Friday remote, it really breaks apart some of the distance where you get a longer stretch of not being exposed, which was part of that original design. Arguably, as we look at the fact that, we're feeling good about the safety protocols, as you look at moving forward with staff, I think they're initially going to feel like, let's implement 4 and see that it's looking good, and then we can discuss whether or not we add the other Friday half day. So, I think it's more that when you're doing testing and if we had pool testing, which is also on the table, if you test on, like some districts test on a Thursday, if you get back a pool that identifies students that are already out of the building, and it gives you a 3-day window before you have to even think about then how much longer you'd have to quarantine before you could return. So I think it was more that in holding the Fridays, you give yourself a 4-3 ratio, which felt more comfortable to people in terms of cycling through any outbreaks.
The second question I had was your timeline lists early to mid-March for getting the kindergartners essentially fully in person. And I understand that there are complications every time you add another grade with the lunches and the things that you've already addressed, but it seems like a month to start doing grades 1 to 6. Is that to complete getting grades 1 to 6 in there, or to start getting grades 1 to 6 in there? Because a month seems like a long time.
Yeah, no, I think that, again, and looking at a release where I wanted to make sure that given the amount of discussion and, intense feelings around all of this and everyone's anxieties and wants, I wanted to make sure that anything we released in public was very, very clear. So obviously the return to K gives a target date, and then we would be moving as quickly as we can with appropriate planning. I don't think it would necessarily be that much longer with other grades, but we need to take each one and layer in, the next step. So I don't think it would be that long, but again, it depends on, again, you've heard me already articulate getting first grade in as an urgency. So that would be a priority to get in sooner.
Okay. And I think we all understand that everything is data driven, and if there are, circumstances change, you deal with that. Dr. Walsh, if you want to take a turn presenting, if you can succinctly cover some stuff.
Narrowed as much as I can, Alan.
And I'll just say for anyone on the call, I know that this was a mistake on my part. We had scheduled 45 minutes, which is coming up in about another 5 minutes. We will keep this going as long as necessary. Steve, you can groan now, but in any event, we're not going to end this abruptly. So people who have been patient, you will get your say.
Can you see my slide that says CDC Guidance highlights?
Yes.
Yep.
So basically, I went through the guidance, and they had a couple of major things that I took away from it, and I kind of just wanted to share that. One is they have a color-coded school reopening strategy, and it's mostly based on community risk. What they've kind of found was that whatever is happening in the community trickles over into the schools, and that more so that direction than the other way around, where schools are trickling into the community. And so they put a lot of emphasis on this community risk. They did say to factor in if schools are actually they could be doing better or worse than the community in general. And in fact, I think in Westborough, the protocols the school has been doing has been excellent. So thank you, Amber, and everyone else who's involved, because what I see is that the schools actually seem like they are potentially even safer than the community in some ways. So it's good that you guys have put that in. They did highlight the mitigation strategies that Amber had said. So proper mask usage by all and 6-foot distancing were the things that they highlighted in the report as the most important priorities. They also listed hand washing, cleaning, and contact tracing as also being important. And they said that the cohorting and the plotting is recommended. And so they kind of had broken this down. They repeated the proper mask usage and the distancing over and over again. These other ones were less and less. And I think the testing and vaccination, I took away that they seemed like it would be helpful. And they did recommend kind of a tiered rollout for the testing and vaccination. And it was mostly based on disease severity. So they recommended that for this, the staff and then the high school and then the middle school kind of trickling down toward the younger ages because of the fact that the severity of the disease is worse in the older age groups. They did say that the town should prioritize schools to be the first to reopen and the last to close compared to all other non-essential businesses, so that the CDC, I think here was trying to emphasize the fact that schools should not be fully closed. And I'm glad that we were able to get our schools open and comply with at least the hybrid model. And so I think that's very positive. The other thing that they stressed was health equity. And they mentioned this over and over again in their report, and I don't really have a great sense as to how we're doing, other than I think that we're doing really well, but that's just my sense. But this is dealing with the fact that some kids might not have the same technology. Obviously, there could be kids that are missing meals at home, that are dealing with homelessness. So the CDC guidance was kind of overarching across the whole country, and so some of it applies to us, but they had a very large focus on health equity. As far as the risk and how they recommended reopening, it was kind of a tiered approach that I think very similar to the way that Amber has laid out with focusing on the younger ages. In their report or their guidance, it was less about the fact that they thought that kindergarten and first grade was more important or more essential or somehow important from that point of view. What they stressed was that a tiered reopening was good because there was less risk at the younger ages. The kids didn't get as sick, they didn't spread it as easily. If it worked with the younger ages, then you could kind of keep pushing up to the higher grades to see if it will work with the higher grades. But the safety protocol was what they were particularly worried about, and they wanted to make sure that you could do it with the kindergartens before you rolled it out with the older age groups, just because of the how easy the kids pick it up as they get older. They did also mention that infections will still occur. When you have it in the community, you are still going to get kids that get it, and that shouldn't necessarily be a roadblock to moving forward, but that it's real important that the schools plan how to handle cases and stay open. And I think that we've been doing a very good job with the contact tracing that we've been doing. And so I think that that's also very positive. But for those schools that are just beginning to open now, obviously they're still trying to lay all that handwork in. And then of course the other part of the guidance that I saw was that they really did want to allow parents to be able to choose a fully remote option. So instead of forcing all the kids to have to go to one particular plan, if you had a plan and that you still gave the other people a fully remote option, that was kind of what the CDC was recommending. They did spend a fair bit on masks, and maybe we can come back to this because I think we've got a different section on masks. But with the physical distancing, they did over and over again pick this 6-foot distancing that they were recommending. They recommended that cohorting be groups of people that stay together throughout the school day, and that they should be as static as possible, and to limit mixing between cohorts, and to really consider all available safe spaces in both the school and community facilities in order to make sure that you could have enough space to have your classes. They also recommended staggered scheduling where you could change school arrival and drop-off times, and also to alternate schedules with fixed cohorts. And that's actually very similar to what we've been doing with our hybrid mode. They also said that one recommendation would be to install physical barriers and guides. And this would be especially important where 6 feet couldn't be maintained. And they specifically referenced like the reception desk at the front of the office. And so I just want to take a couple minutes, if I can still go a little bit deeper, Alan. I've got, as far as the guidance and how they characterize the different areas in terms of red, orange, yellow, and blue. They basically looked at the number of new cases per 100,000 people in the past 7 days. And they basically said that if you had more than 100, you were red. If you were 50 to 99, you're orange, and so forth down the line to blue, which is 0 to 9. And so Westborough has about 20,000 people, a little bit less. And so you basically have to divide these numbers by 5. And that's, if you were to take these numbers and apply it to Westborough, that's where we would be. And so it would turn out that, and for us to be blue, we'd have to have less than 1 case a week. And that's like 1 person. And so if you had a family of 4 or a couple of families of 4, you could easily boost yourself right into the orange. And so I think that some of these CDC guidelines are, might be better for larger communities rather than an individual town. The other part of the criteria is about the PCR-based tests, so not antigen tests, but the PCR diagnostic tests. They're also called nucleic acid amplification tests. That's what the NAAT is. But our positivity rate is well below 5. I think we're in the 2 to 3% positivity range. And so the CDC criteria for labeling school districts or labeling communities that are capable of different color categories here, they wanted to take the most conservative of the 2 approaches. So if we were, red in the total new cases per 100,000, but blue in terms of the PCR tests positivity rate, then they would still want to characterize us as red. And so because the second one doesn't matter so much for us because we were been in the blue for so long, if we just look at the number of new cases per week, and so this is for Westborough, I've plotted the numbers from the Board of Health. And then I've put on that background the color codings based on the CDC's chart or recommendation. And so you can see that we the blue line is almost barely visible because it's only a single case, and then we have the range where you're yellow to orange to your red. And so you can see that on these, hopefully you can see the dates, but this ranges, I think, from last March all the way up through February of this year. And so we have that summer lull, and then we've got the increased number of cases, and it gets especially bad around Christmas time. So as I was trying to say that, the number of cases here, I mean, just 3 families infected from traveling could move us right into that orange category. And so I'm not sure, how much weight we want to put into these numbers and these categories from the CDC, but I just wanted to explain it to people so that they have some context of where this is coming from.
Okay.
Can I do one more slide?
All right, go ahead. One more.
Thank you. So if there is not broad testing within the schools, they have a chart for where they recommend schools should be. And what I've done is I've highlighted in yellow the part that I think is appropriate for Westborough. And so because of where we fall, we're red in the number of new cases per 100,000. For the elementary schools, that would be hybrid learning mode or reduced attendance. Physical distancing of 6 feet or more is required. And then for the high school, it says schools that are already open for in-person instruction can remain open, but only if they strictly implement mitigation strategies and have few cases. And then for the sports and extracurricular activities, they recommend that they are virtual only. So I think that we're in line with where we are right now. I think that we're doing the hybrid mode. I think it's actually working really well for us. They do have some caveats in there about if schools are doing well, they've got a little bit more leeway than if some schools are doing really poorly, that you shouldn't just use the community data. So this is just all of a recommendation, but I kind of wanted to put my thought on it. And so with that, Alan, I'll turn it back to you unless there are questions.
Okay, thank you, Nathan. And I just my own comment on this is that I view the CDC stuff, it is labeled as guidance. It's not absolute rules, and so it should inform our discussions, but we are not necessarily bound by it. I do want to make a program note, so to speak, for Katie Curran and others who have joined we are running behind, so other discussions are going to be delayed while we continue with the school discussions. Okay. Dr. Hashmi, do you have any questions or comments at this point in time? Otherwise, I'm going to invite the people who have signed on from the public to weigh in at this time.
I just, so Dr. Ehrlich, can you hear me?
Yes, go ahead.
So one of the things, so first, thanks to Ms. Bach and for presenting, and I also want to acknowledge Dr. Walsh's and your leadership during this, and this has been critical. I just wanted to remind the board, and in case anyone is listening, that in our mission statement, it says the mission of the Board of the Health is to prevent and control the spread of disease, but it goes on to say that it's protecting and improving the health and the well-being of all people within the town of Westborough. And one of the things that is certainly that has that I've come to realize over the past, I guess, few weeks is the urgency of the urgency of this issue for so many families in our town that are truly being stretched. Invariably, when I have these conversations, parents are asking me, "Am I a bad parent because my kids are falling behind? Is there something that I'm doing wrong?" So I think that urgency is something that we cannot forget. And then one last thing about I know we can talk about this later between the 3 and the 6 foot. Correct me if I'm wrong, and you're the physician on the board. The 6 foot, the original data for the 6 foot distancing came from, I believe, Dr. Flug in 1897, and I think he looked at the transmission of bacteria. But that 6 foot was not, that's transmission of me coughing, like for instance TB, and he calculated how far my spit would go. But that was not me wearing a mask. So I just we can have a discussion about that later. And I guess I want to hear what our residents have to say, and then I'll continue my comments then.
Okay, I'll just comment about the 6 foot issue. That figure is based on how far, not so much any particular organism, but how far droplets are thought to be transmitted. Again, in the phase of active coughing, there have been some studies looking about that in the current pandemic. Most of these are done in sort of a laboratory setting. People cough into a box or something like that. And typically it's done without masks. So the extent to which masks mitigate droplet transmission usually doesn't get factored into that. And again, things are, these are not absolute. So I know in Europe, where they don't use feet, they use 1.5 meters instead, and it comes out to about the same thing. So it's closer to 5 feet, but whatever.
So can I interject for a second? So what we're saying here is that the CDC is using data from the 1800s.
I'm not saying that at all.
No, I'm just
No.
giving a historical background, Dr. Mayor.
I mean, I do think that's what I was hearing here, is that the CDC actually is being sort of overridden by
No,
Syed's.
that's not what I said. I just said that the original data for this, Dr. Mayor, comes from Dr. Flug, who did those original studies. That's where the 6 feet distancing comes from. Dr. Ehrlich, would I be incorrect?
No, I understand what you're saying, the implications of which is that the CDC is wet behind the ears.
No,
Okay,
I'm not saying that, Dr. Mayor. What I'm saying is that with a mask, there could be differences. Okay, that is what I'm saying.
Again, the way I would frame it is that we have a number of strategies to mitigate the disease transmission. Masks is one of them. Social distancing is another. In principle, if you're adequately socially distanced, you don't even need to wear a mask. If I'm out about in town and it's cold and it's night and nobody else is around, if I don't have a mask on, it's no big deal. If I pass other people, if I'm jogging, I'll pull the mask up or whatever. But the point is that, again, these things are part and parcel of a package of interventions. And they all have some data supporting them. None of the data in these things is perfect. We don't do randomized controlled trials on these things. Okay, I see that we have 2 people who are here. Steve, I don't know if there are others, Dr. Pellish and Dr. Terrell, and I don't know if they're working together. And they have a joint thing or they're each independent. In full disclosure, Dr. Pellish is a colleague of mine. We work together at Reliant at ReadyMed Plus together, just so people are aware of that relationship.
Yeah, I don't see any others, but I could be wrong. But I looked down the list. I think that's it for now.
Well, since Dr. Pellish is unmuted first, I will defer to her. You may go first.
Thank you to all the Board of Health members for having me today. My name is Alyssa Pellish, and I live at 32 Blake Street. So I think all of you, or most of you at least, were emailed a document today that many local physicians and healthcare providers have signed. And I'm just going to read that with some edits to it and just sort of to voice our opinions and let you guys know how we as medical professionals feel in this on this subject matter and getting our kids back to school. So I'm speaking not only on my behalf, but also for a group of physicians and medical professionals who believe it is extremely important to get our children back in school full time. And first, I would like to thank our hardworking teachers, administrators, staff, school committee, Board of Health members, and everyone involved. That this has been an unprecedented time, and we know our teachers and staff have been going above and beyond to try and educate our children. And in no means are we trying to take that away, to say that they're not doing a good job. We know that everyone is really stressed right now and trying to do the best that he or she can. So our main belief is that with the proper mitigation factors in place, it is safe to bring our children back to school. And we hope that you, as members of the medical community, will agree. And according to Superintendent Bach, there has been minimal spread of COVID-19 within our schools. As you mentioned earlier, there has only been 3 possible cases of in-school transmission. This is much lower than the community spread at the time. So that is, we all find that very encouraging. The medical and scientific community has known this for many months. The American Academy of Pediatrics endorsed the return to school as early as July 2020, and Dr. Fauci encouraged school return in August of 2020. And now, with even more data recently published, these findings are validated. President Biden and Dr. Walensky, the new head of the CDC, have both made it their mission to open schools. They believe that they should be the last to close and the first to open in society. We as physicians and medical providers in this community are in agreement with this statement. Since the initial wave of the virus began, there have been a number of studies released in the medical literature, nearly unanimous in their findings, both nationally and internationally, that it is safe to send our children to school. Moreover, community spread of COVID has largely occurred at private social functions and not in school settings. So there are a number of cases, number of studies that have recently come out. Just briefly summarize it, but there's one in Mississippi, a case control study with kids ages 0 to 18, and found that having attended gatherings and social functions outside the home was associated with an increased risk of infection, and attending in-person school was not associated with an increased risk of infection. In the fall of 2020, there are 11 school districts in North Carolina with more than 90,000 students and staff that were open for in-person education. And over those 9 weeks, in-school transmission was very rare. 32 infections acquired in school, while 773 community-acquired infections, and no cases of student to staff transmission, which I think is extremely important because I think that's what the staff is most concerned about. And then in a report released by the CDC on January 2021 with data from 17 K through 12 schools in rural Wisconsin with high mask adherence, the incidence of COVID-19 was lower in the schools than in the community. During the 13 weeks in the fall of 2020, there were 191 COVID-19 cases in staff and students, and only 7 of those determined to result from in-school transmission. The hybrid model and the fact of not being in person in school full time is causing significant harm to our students. And Dr. Neil Tyrell will be speaking after me, and he will be speaking about the mental health, which is just as important as academics, and our children are suffering. And he will go into that in more detail. There are more subtle effects from school closure as well. Families of our younger children are often forced to cobble together childcare solutions that are riskier for the spread of COVID and not necessarily sufficient to meet the needs of these children at a critical time in their development. And parents are suffering too. Many parents of school-aged children are exhibiting signs of depression and anxiety. The amount of toxic stress, especially in teachers, frontline workers, single parents, parents of children with special needs, is alarming. We know that mothers are disproportionately bearing the brunt of this extra burden too, and the sacrifices and strain on mothers in particular are rarely mentioned in these school conversations. So we do appreciate and understand the fear associated with returning to school. I myself had a lot of fear of going to work every day in the beginning of this pandemic in March when we knew nothing. So in the beginning, we didn't have access to protective equipment and we didn't have data. So of course our schools should have been closed. But we now have a lot of data, not all of the data, but we have a lot and we know how it spreads. We need to start to temper our fear with the science and data that we have. Returning to school is not without risk, and there will be cases of COVID in the schools. But if we continue following the data set forth by the scientific community, the likelihood of spread is low. This risk will continue to fall as high-risk populations and our teachers, and much later, everyone else in society is vaccinated. But vaccination is not a prerequisite to return to in-person learning. We know that masking and maintaining physical distance are the mitigation factors that need to be in place. Returning to school full-time is a risk worth taking to mitigate the effects of COVID and remote learning now and in the future. We ask you to prioritize returning to school full-time for all students in our district. The CDC just released these new guidelines that suggest that school can return full-time in all but the highest level of community spread. There are mitigation factors that need to be in place, and we need to do these now because even with vaccination, COVID is not going away anytime soon. And as to the discussion we just had about 6 feet of distance, that was initially derived when people were not universally wearing masks. With masks, that 6 feet of distance probably does not need to be nearly that large and can be anywhere from 3 to 6 feet. So I work in a hospital setting, in the emergency room, and in an urgent care, and we are never 6 feet apart. But we are masked 100% of the time. And we have not had any outbreaks in either on the floor where we are wearing masks. There have been outbreaks, and those have been in the break rooms. So we are going to have to learn how to live with this disease to minimize its potential spread and get back to educating our children. And just lastly, we just found out that there is a safety committee, but correct me if I'm wrong, I may not have all the correct information, but I was told that there's no physician or medical provider on that committee. And we would ask that there be a medical professional on that committee if they are determining safety precautions when kids can go back to school. So that is all I have. So thank you for your time.
Thank you, Dr. Bellish.
All right, is it me?
Alan is talking, but we can't hear him.
Yeah, thank you, Nathan. I muted myself. Any questions for Dr. Pellish before we hear the follow-up from Dr. Terrell? Okay, Dr. Terrell, please. I'm sorry, Amber?
I was just going to thank her for her comments, and I just was putting in the chat, like, I agree with her articulation on distancing, and I'm disappointed that the CDC was not more progressive in articulating a clarity that would guide people with more assurance on the distancing. It complicates things in ways that can be really unnecessary.
Yeah. As I was reading,
frustrating.
Kind of read what the CDC was saying, and I hopefully say that that's what I was in favor of. It was more that that's what the CDC was saying.
Yeah. But the other point, just to make one, so we'll move right into Dr. Terrell's comments. I don't want to slow him down. I'm anxious for him to speak as well. Just to comment that the safety committee, I can talk more about that when we're done. We should come back to that, but I want to talk about the interface of how we use that with the Board of Health. So yes, we can come back and discuss that. And I'll turn it over, I guess Dr. Terrell's probably up, right?
Yes.
Great. Can you all hear me?
Yes.
Great. Okay. All right. So thanks so much for giving me the time to talk today. So again, my name is Neil Tyrrell. I live at 45 Church Street, and I'm the parent of 3 children in Westborough, kindergarten, 4th grade, and 8th grade. Besides that, I work as a physician. I'm a pediatric hospitalist at UMass Memorial Hospital. I'm also the inpatient director for pediatrics and the chief quality officer for the Children's Medical Center. Beyond this, I was redeployed during the COVID pandemic, during the first wave and the second wave, and I've seen firsthand the effects of COVID on dying adults, as well as the impact of this pandemic on children. The specific reason I wanted to speak to all of you today is to clarify that there's a catastrophe happening right now in the world of pediatrics, but it is not the COVID pandemic. People were asking questions earlier about how many of those kids were hospitalized. And I can tell you that my group, who takes care of basically all hospitalized kids in central Massachusetts, we saw like almost none who were hospitalized. And there were 2 patients in this entire time who needed to go to the ICU, and they were late teens or kids with really severe other issues. So, I mean, the burden of disease in kids with coronavirus specifically was extraordinarily low. But the catastrophe I just want to talk about is the mental health crisis in our children. Now, we all recognize the importance of school in our community as the importance of that. But over the past year, it's just been amazing to see. It's become so clear the incredibly stabilizing force school has in the mental health of our children. So my group of hospitalists, we're no stranger to dealing with mental health in children. And historically, our group takes care of 2 to 3 young people each week with significant psychiatric illness, such as anxiety, depression, self-harm, eating disorders. But since the start of this pandemic, we have seen a remarkable increase in these patients. We now routinely have 8 to 10 pediatric patients admitted to the hospital with these conditions that require inpatient psychiatric care. On top of this, there are almost always many suicidal children boarding in the emergency department because we simply don't have enough physical beds for these patients in the hospital and in the state. This morning on my service, for instance, there were 11 such patients admitted to the hospital, and there were another 10 who were boarding in the emergency room. 21 total patients with psychiatric needs requiring one-to-one focused care. These severe situations the most severe situations end up being admitted to the intensive care unit, where we have seen a 150% increase in the suicide attempts over the past 6 months in comparison to the same time period in 2019. Our experience in the hospital is simply the tip of the iceberg, however. The physicians caring for children in the community are experiencing an even more pronounced crisis. One pediatrician in our community in Westborough states that they spend up to 75% of their time currently dealing with mental health related issues in their patients. Further, when they're seeing parents of children, school-age children, mothers of school-age children, they've said that they're seeing nearly a 50% chance that they're going to be starting that parent on an SSRI in order to deal with the anxiety related to dealing with their children. At these visits, nearly all parents of children report issues in parenting and not being able to treat their children in the way that they would like to. With up to 10 to 20% of the patients that they're being seen in these offices are in complete emotional crisis. When we are looking at the data regionally, it is just as concerning. Since March, there has been a 33% increase in mental health related ED visits back in relation to 2019, and a remarkable increase in boarding hours of pediatric patients waiting for psychiatric beds. I bring all of this up because we regularly talk about the risks and dangers of coronavirus infection in relation to school opening. These are certainly super important metrics to evaluate. However, we need to recognize that there is a clear epidemic of mental health in children that is correlating with the absence of the stabilizing force of in-school education. This committee, I would ask to assess the risk of fully opening our schools, the risk of coronavirus, but also what is the risk of not fully opening our schools. It is not a question of the risks of COVID versus no risks. Rather, it is the risk of the COVID pandemic versus the mental health pandemic that is plaguing our children at this time. I urge you to assess these risks when advising the school board, because it is, in my unique vantage point, I cannot see how it is safe for us to not fully open schools soon. Thank you very much, and I'm happy to talk to any of you individually. And also, thank you so much for the work that all of you are doing.
Thank you, and I apologize for mispronouncing your last name when I introduced you. I have a question for you, which is, you presented a lot of compelling information. Has there been any analysis of how these mental health issues are distributed amongst students who are fully remote in a hybrid situation or fully in person for those who are able to do that? And I ask this in part because obviously, school aside, there's been a huge uptick in mental health issues, not just kids, it's in adults as well. The inability to meet with people, people are restricted, the inability to take vacations, the inability to participate in sports, all sorts of our daily lives have been disrupted. And so my question for you is there data showing that the fully in-person mode mitigates the generalized increase in mental health problems that our society is experiencing?
Not to my knowledge.
Okay.
No, I've never seen it fully broken out that way, and I totally agree with you. And I was pretty careful not to say causation, but
sure.
It's a tough thing, and I don't mean to say that school is everything, but it just seems to be such a stabilizing force in kids, and it's more that I just want to really highlight that it's not a choice of risk versus no risk. I really think I'd be shocked to think that the stabilizing force of schools wouldn't do a fair amount to mitigate this.
No, but it might be interesting to look into. Other questions? Dr. Walsh, you have a question?
No.
Okay, you unmuted. One thing I want to be clear about and provide just a little background. So the Board of Health has been acting as a resource for the school department. And when the school department has plans, the Board of Health will comment, make suggestions on how those plans might be improved. There are many factors besides, is it safe for kids to go back in a fully in-person mode that are beyond the purview of the Board of Health. Things like teacher contracts, things like buses, things like how do you maintain it for those who need to be remote. Those are all, logistical issues that, our superintendent has to contend with. And those are not, strictly speaking, Board of Health issues. And I will say that the Board of Health has been encouraging of more in-person learning for quite some time. We are prepared to support that. We have not. I don't think we've made a formal recommendation at any point. And Nathan, you can correct me if I'm wrong about this. But we've certainly been asking. What is the plan to get students learning in person? What would be the parameters, the benchmarks that would need to be in place vis-a-vis the pandemic that might make that possible? And so these conversations have been going on. And obviously, you heard from the presentation, there's already some intention to try and get more in-person learning. The speed at which that happens, is something that can be discussed. But I think we're all in agreement with the general tenor of your comments and your suggestions. And we as a board, I think I can speak for my colleagues, we'll do everything we can to support the school department progressing as rapidly as possible, to do so in a way that we believe is safe. And we've made a number of suggestions so far. I don't know if either of my board members want to elaborate on that, or go ahead,
Dr.
Nathan.
I'd like to also.
All right, Syed, go ahead.
So, just as a follow-up, our responsibility is towards the health and well-being of the residents of our town. And as we've heard, and the data that has been shared with us, there is a devastating epidemic of mental health that is going on in our communities. And I think that puts an urgency on this board to say that we need to move forward with this as a town. I think with some urgency, with proper mitigation. And correct me if I'm wrong, and I don't know if Steve knows about this or not, but I believe Northborough and Southborough, I think Algonquin, they share high school. And Algonquin had a committee, I believe, with 3 physicians. And I don't know if Steve knows this or not, but they're planning on going fully in person, I believe, after the holidays. I don't know if anyone else, but this is what I've heard. So I think
No.
they're
They're planning on to go fully in person if possible, is what it says in their timeline, at the very end of March.
Okay. Just to be clear, on our mandate as a Board of Health, I would say it is to promote the health and well-being of the residents of Westborough, but also the town employees who serve those residents as well. I don't want the teachers left out in any way. Nathan, go ahead.
Yeah, even expanding to anybody in Westborough. But so I think, though, I wanted to thank Dr. Tyrrell. I appreciate your comments and your feedback to us, because I had underestimated the impact that this was having on kids being out of school. This is actually kind of surprising to me that this is actually quite as substantial as it is. I think that when I was thinking about the risks of not being in person, I was thinking about, are you more likely to pick up COVID while you're at home versus whether you were at school? And even that limited data was indicating that schools might be safer. But this is a whole new level that I hadn't really considered, was, the impacts of not being in school. And so I actually think that as far as a Board of Health, what we might want to be encouraging is actually more aggressive than what Amber and Daniel have laid out, and really encouraging the trying to get back to school, full in person, faster than they are. And obviously we can recommend stuff, but if there's no logistic way to do it, there's no logistic way to do it. And I don't want to set people up for failure if it can't be done. But to really make the case that it is important, that we think that there really are some risks associated with not being full in person, and to make the schools aware that those risks exist and are real, and that they should be considered when you're deciding how fast and to roll out, because those are important. So I think that's what I wanted to say.
I would agree with you. I'm sorry. Go ahead, Amber.
No, Dr. You go and then I'll comment.
All right. So I agree with what you're saying. And, we are, as a board, we're well aware this is ultimately a decision of the school committee and the school department. We can recommend things. And I think we've been a little reluctant to do so up till now, because there have been a lot of other factors in play, and we've been working well together, and we've been supporting the initiatives that you have brought to us, and to make things possible. And I think that's all been good. What I am leaning towards tonight is actually being in alignment with Dr. Walsh in potentially a motion to encourage in-person learning as rapidly as possible, with the notion, not that we are necessarily telling you what to do in any way, but giving support as you have discussions with other groups, whether it be the teachers, the school committee, or whomever, that the Board of Health at this point in time believes that we can have much more in-person learning than we have right now without significant risk to the health of the residents or the staff.
Dr. Ehrlich, can I add to that motion?
I haven't made
Okay.
it yet, but you get the idea. But
Well, I
sure,
think
go
one
ahead.
of the other things that I would certainly recommend, I would say that the board has. I'm supportive of the motion that we move to urgently towards complete in-school learning, but I would also urge that the board potentially urge, as the presenters mentioned, having input. There are already people that are committed to this process, and I think it would be helpful, and not to throw Nathan under the bus, but Dr. Walsh is somebody that is committed to this process, has invested his time and his effort, and there are others in the community that could serve as resources to help. And I think that if we, encourage the school to include voices like Dr. Walsh and others, I think in the long run it will build trust with the community. That hey, and I think I have faith in Nathan. If he will speak for me. If the school, if he speaks something at a school committee meeting or whatever, I have faith that he will represent certainly what I'm thinking.
Amber, you've heard from us. What are your thoughts?
Yeah, just a couple pieces, which is we do actively take Dr. Walsh's advice. We do it in this open forum where we come and you advise us. And when you've made recommendations to them, we've either debated them here with you or accepted them or followed them. I believe we have only diverged once as a committee from you, with the school committee voting for the remote week following vacation, which was a recommendation where you said we didn't need it and we opted for the 1 week of remote. And your guidance we have on record, which is an important part to the public process. And we take every piece of medical advice and guidance and recommendation you've given us as the anchor that we've actually used to open and to stay open safely. So I just want to indicate we welcome feedback from everyone. The safety committee is an implementation committee. It implements the guidance that we've referred to you for affirmation and received the clearance, I guess, as I see your guidance to move forward. Our work has been collaborative to run the district and keep everyone safe. And now we're on this trajectory where data is coming forward and we are seeing changes. And we've also seen spikes and we've also seen variants and we've also seen vaccines. We've also seen pool testing. So the active phase of moment to moment work on this has been a relationship we've shared with you from the beginning. The safety committee is not making medical decisions. It is not skilled to, nor would it try to. It is the building-based negotiation of comfort for moving forward and answering questions that teachers ask. It's a complaint board. Okay, it's a problem-solving board. A faculty sends questions to the safety committee about concerns they have at the school level, down to the most microscopic level. And we answer them and we check with the Board of Health and the nurses and we answer those questions. Any of the changes to protocols we've made have been when the CDC has updated guidelines. So we change accordingly and we've affirmed it with you each time. We want to be open. We are taking steps to be open. We are taking steps with the communities around us to move in the direction of being open. And that is the work of our industry right now, because we've only just come to the cusp of the information that's making it a possible solution for us to take new steps. I anticipate that we will be doing exactly as we've mapped out, and the speed will happen as we can make it safely. And certainly any recommendations we make for urgency are welcome. And we'll be back to continue to look at things with you. I do want to be clear, to speak on behalf of our faculty, that it is a faculty that understands mental health, is deeply committed to it, and recognizes what students need. And we have returned our most needy, most struggling, and oftentimes most emotionally compromised students who need to be in person, at close to 900 students of the 2,800 to 4 to 4.5 days a week of in-person instruction because of mental health, where we could use data and information from doctors and parents and classroom teachers and guidance counselors to guide us to make sure we were meeting the needs of the most needy right away, because we understand mental health and know our role as an anchor. So I totally agree with the assessments of our families and our parents and our medical advisors as parents in collaboration who are reiterating those important goals. I don't think that we're all far off on the targeted goals we share. I certainly can promise you that I answer to many, many stakeholders, and each of them have to be a high priority, and we have to find a way to knit all of those priorities together. So I would certainly welcome your recommendations. We always have. They guide us, and we will use them to continue. I'm happy to have Dr. Walsh sit in on safety committee meetings. I think that we pretty much call him on every item where there's a need for guidance. But I find this, as always, very insightful and helpful, and I'll turn it back to you, Dr. Ehrlich, for a motion.
If it's okay, I would like to interject too. I mean, I want to say that, is it okay for me to talk, Dr. Ehrlich?
Go ahead.
I want to thank Dr. Terrell and Dr. Pellish, and there's nothing more important to us than the mental health and well-being of our students. That takes primacy over even the academic well-being of our students. I will say, from my vantage point of being a resident of the state of Massachusetts, I know that we are perhaps the preeminent state in terms of healthcare.
We all
and
agree
knowledge.
with that. No doubt about that.
And I will also say that I have done my due diligence with the list of schools that have already opened up. And I've contacted schools like Carlisle and Medway and Wellesley. And, there's of the 365 school districts, there's less than 10% have opened up to their students. And when I contacted those schools, Holliston is on the list, Weston's on the list, Lincoln's on the list, Concord's on the list. The exception, like to a T, is they have space. They have 6 feet. They've opened up because they have 6 feet. Now, that's not to say that we can't go by different guidance, but I will tell you that personally, as a professional, who's working in the field of education for my entire life, the accusations that somehow we have something other than the best interest of our kids in mind, and that we're somehow behind other school districts in the state, when I think we've done our due diligence and we're working as fast as we can with our neighbors to move us forward. And we're right where I think we need to be. And I know I'm talking to a larger audience than this health board here, but I do think that, we're not behind where everybody else is. Again, we're residents of the state of Massachusetts, and you can call those other districts too and ask why they are open and we're not. And I think that, we're headed in that direction. And there's been no failure of leadership by Dr. Bach, who's one of the most, as far as I've concerned in my entire life, I've never worked with a better person in education who's more able to lead a school district in the time of crisis.
Okay, Nathan, before you make, go ahead, Dr. Hashmi, go ahead.
Just as a quick reminder, the New York Times had an article this weekend on Providence. Providence serves 22,600 students, which is bigger, I believe, than the state, our population of Westborough. And they've had in-person learning since, I believe, September. And they're a mixed district, so they are not able to, I understand. I mean, first, let me understand. To be clear, I'm a former educator. I come from a line of educators. We want everyone to be safe. But I think focusing just on the physical distancing they have been, as I said, Providence, they've been in person without any increase. I think we need to focus on the fact that, manage the cost-benefit ratio so that in the long run, our children benefit and our teachers are safe.
Thank you. If I can just make a comment that I think is important to just add to the discussion before we go to a motion, Nathan. A conversation that we didn't really discuss tonight, and I'm just going to summarize in one or two sentences, is that there was a discussion about the role of using pool testing. And my own view on this is that it doesn't really help all that much in general, but that it has one purpose where it can be very helpful, which is making people feel comfortable with fully in-person learning, where you're routinely surveilling your population. And so we had a conversation with school nurse, Steve, Amber, myself, where we hashed through a lot of that. And so that is just another tool that is available to help. And obviously, the school department is well aware of that, and they are investigating different options. So if anyone was curious about that, I just wanted to put it out there that that is something that has been discussed as a way to facilitate going fully in
Right.
person.
And I promise I won't interrupt you again, but I just want to make sure that we get off this call with all the facts clear. You guys do such a good job of clarity. Dr. Hashmi, I just want to indicate that the term in person can be really misunderstood by lay people and even people in education. Providence is in a hybrid model. They are in person in a hybrid model, as we are, and as Westborough Public Schools have been since the start of school. I mean, there are lots of discussion points to be made. We are very committed to returning our students. We are passionate about this work and urgent as well. And we've been functioning in that same model that you're just illustrating, and we've been doing it very successfully, while we've also returned over 900 students to even more in-person learning. So we're all on track to move forward. I found, of course, the mental health discussion deeply compelling, as we know it is, and having someone else articulate it is always just, another impetus to keep moving. So thank you. And I won't say anything else, and I'll turn it back to you, Dr. Earl.
Yes, before you make your motion, Dr. Walsh, just because this is a virtual meeting, and I want everyone who watches this now or when in a recorded fashion to understand everything that transpired. There is another comment in the chat from Dr. Pellish. We want to be ahead of other districts. We need to be creative about space. My daughter tells me the library and the gyms and the cafeteria at the high school are not used to their full potential. I don't know that a response is needed. I just want that sentiment to be out there. And we've taken quite a bit of time. And so unless there's something really compelling, I would like a motion and to let us get to the rest of our meeting agenda.
So I have, in addition to that motion that I'd like to make, we have one issue that was part of the packet that they were asking, I think it was the nurses that were asking about the use of playgrounds and how often they should be disinfected and how we would recommend doing that. And so I think that should also be one of the very concrete things that the Board of Health can give, is when they ask us specifically about certain items that we respond to that. So I don't know, Alan, shall we do the motion first?
Let's do the motion first and then go to that. That is the next item on our agenda immediately afterwards, but I would rather wrap up this package and then we can talk about that, because that's going to happen regardless of anything else. So
Right.
If we do the motion first.
So I'd like to make a motion that the Board of Health recommend to the school department that they aggressively pursue full in-person learning, bearing in mind that we realize there are logistics that have to be happened, but that it's important for the safety of the students, their mental health as well, to achieve full in-person learning as soon as possible.
Is there a second? I'll second it. Okay. Paula, do you have any questions about the motion? You're mute, yeah.
Yeah, no, I don't.
Okay. Any further discussion? Okay, roll call vote. Dr. Hashmi?
Yes.
Dr. Walsh?
Walsh, yes.
Dr. Ehrlich, yes. Okay. We will now proceed to the issue around the use of shared equipment on the playgrounds. Dr. Pellish, Dr. Tyrrell, you're both welcome to stay or go. but thank you for your participation this evening. Okay, Steve, you want to just briefly present?
Sure. So there were two parts to this, which I kind of put together under one heading. So the first part was the physical education department always had a policy of using shared equipment, things like jump ropes, hula hoops, frisbees, those sorts of things. And when they first came out with this, when school first started, there was a certain policy, and they wanted the board's opinion on changing that slightly. So originally they were limiting the number of students who could share a piece of equipment to 4 in a group, and they would like to expand that to 8. And that seems to be the major part of the first item that we need to discuss.
So let's focus on that. First of all, does anyone have any questions about this? I mean, there was background material. Again, we have very little indication that this is a source of transmission. I will note that there have been some reports that, by and large, the vast majority of transmission of COVID is coming about through respiratory droplets, and it is not through what's called fomites, inanimate objects, where the virus collects and then people touch and somehow contract the disease. So that while it's theoretically possible to spread that way, there has been very little evidence in this pandemic that is a meaningful contributor to the spread of disease. Again, there's a lot of disinfecting going on, so I'm not saying it's not the result of some mitigation, but nonetheless, it doesn't appear to be a significant problem from my perspective.
Yeah, that was the impression that I had as well. I think that if they're washing their hands or using some sort of alcohol-based cleanser before they go out to play, I have no problem changing from 4 to 8 in terms of the number of people in a group using shared equipment.
Okay, so I concur. Is a motion desired, or just the feedback from this meeting?
There was actually one other topic related to that. I think that they had asked about, or they had listed as the non-use items, like rope, like climbing ropes or tug-of-war ropes. And I'm actually inclined to believe that those should be relatively safe. And so maybe as an additional piece of guidance, we can give, whether that should still be on the do not use list.
Yeah, I'm a little different there. I think there's a difference between a tug of war rope and a climbing rope, because with a climbing rope, you're essentially breathing heavily on the rope while you're climbing. I don't know how well you are at climbing ropes, but when I climb ropes, it's effort. And so I think that is a slightly different situation, because you're like I said, you're directly breathing and potentially spewing virus particles, and then the next person right behind you is just grabbing them and whatnot. So, but whereas tug of war, it's at waist level, people are just pulling. I'm much less concerned about that.
Okay, so
I
maybe
would draw a distinction.
So let's if we could also make the recommendation that tug of war ropes are okay.
Okay.
Good. I'm fine with both of those recommendations. Syed, how do you feel on any of those issues?
I'm fine.
Okay. So Amber, would you like a formal motion, or is that guidance sufficient, you think, to bring back?
I think we can just take the guidance back. Thank you so much. I think it's the kind of stuff that keeps moving us forward.
Okay.
And then I think there was a separate one about cleaning of outdoor playground equipment.
You're correct. So it was kind of two different asks. So yeah, you're exactly right, Dr. Walsh. So they're wondering about, more fixed equipment, like on your playground, that sort of thing. Questions about cleaning frequency of those types of equipment. If the kids hand sanitize before use and after, is that good enough, and how often do they need to be cleaned, that sort of thing. So if you have any opinion on that.
Yeah, so when I looked at the CDC guidance, I think they were saying that cleaning outdoor hard surfaces like playground equipment with soap and water has the largest effect on making sure it's clean. They said that if the surface is capable of being cleaned with a disinfectant or a diluted bleach mixture or a 70% alcohol. Those were all fine for disinfectant. But that they thought that whatever you do, you should make a plan, you should follow the plan, and then reevaluate the plan to decide if it needs to change. And so I think giving some guidance about what the plan is and then sticking to it and then reevaluating makes a lot of sense. Me personally, I think that cleaning it once a day should probably be the minimum. And that if we can have it cleaned between, like, recess sessions or something like that, that would be appropriate for me. I'm not sure it has to be after every group of 8 kids use the playground equipment, though. You have to run out there and, soap it down and then dry it and, that sort of thing. So that's kind of where I am, is the once a day is probably the minimum, but I'd be interested to hear Alan or Syed's view on this.
Go ahead, Syed.
No, I defer to Dr. Walsh.
Okay, so what I would say is that I think this, once a day is fine from my perspective. If you do it twice, okay. I agree, you don't need to do it all the time. This will become less and less of an issue as the year goes on, in my opinion, because one thing we do know about the virus, it's reasonably sensitive to ultraviolet light. And so things that are exposed to daylight and the sunlight are, this is truly a case of sunshine is the best disinfectant. Now, we don't have too much of that right now in Massachusetts, unfortunately, and we're not going to have much more of it the rest of this week. But, as we get into March and April, on sunny days where kids are playing outside, the risk of the need for cleaning is not going to be great. So I would agree once or twice would be fine. Maybe first thing in the morning. Yeah, go ahead.
Can I do, one of the things we've used is the air foggers, the
Misters.
Yeah. Yeah. So I think it's an effective, I think it's an effective tool to do between recesses, to be able to go out and use the fogger on the equipment, because again, it tends to settle on those surfaces, probably even more effective than trying to scrub them. I
would agree that the fogger would be a good option.
Okay, because we could probably layer that into between recess practice, and in a way that carries us through to more sunshine and gives us a way to make sure that the equipment's getting some sanitation.
Good.
Okay. Anything else related to the schools?
I've got one quick thing, and that's that in terms of the distancing that's come up, I do want to just push a little bit on the schools to consider alternative ways to increase distancing, and whether that be outside the box, just kind of challenge your assumptions. Like, if you can consider do schools must they only exist or only run in existing school buildings? Are there other ways that we can bring other buildings in? Are there other ways that we could even consider, does it just have to be Monday through Friday, or does it just have to be 8 to 3? There are out of the box suggestions for how you can, with existing space, increase the number of people that are served by using when the schools are not in session, or as I think Dr. One of the doctors mentioned earlier was in terms of making sure that gym and school spaces are being used for classrooms and that sort of thing. So I just kind of want to, if I've got a whole bunch of ideas that are not necessarily all Board of Health, and so I don't want to take up this meeting, but there are ideas out there that I'd love to share.
Yeah, I think it probably is more of an individual conversation we could have, definitely. Every district's we run gym and music and art and library in those spaces. And so kids are having a pretty normal, typical school experience when they come to school. And we really made a decision we didn't want to house them at a desk all day where they didn't move, and they just were basically stationed to learn in one spot all day, which isn't, I think, what most parents were hoping for when they sent their kids back to be in person. That said, we do leverage spaces and creative solutions. I think there's plenty of good conversation to have, and I think, Dr. Walsh, you and I can have one of those. So it'd be great.
Okay.
Thank you.
Well, I'm going to thank thank both of you for attending and participating and hearing the thoughts of both us and the members of the public who attended our meeting. And we're going to move on to other business.
Thank you, guys.
Thank you very
Thank you.
much. Good night.
We now come to the Waste Management Task Force, and Katie has been incredibly patient. I apologize. This was poor planning on my part, but by the same token, I think that the discussion in the schools is extremely important. Something that people are very much interested in knowing that the Board of Health and the school department are working together, addressing the concerns that legitimately people have, both with respect to the pandemic, with respect to the health and well-being of the students and staff and whatnot. So I didn't want to cut that discussion short. So I apologize to you for your being delayed, but now that you're here, I as we usually do, just so you understand how our board works, I'm going to ask Steve to just introduce what's going to happen. When it is your turn to speak, just give your name and address for Paula for the minutes purposes. Steve?
Okay, so as most of you know, Katie is involved with the waste task force that we have. I don't know if are you the chair technically?
She is the chair. We voted her to the chair.
Yeah, no, I should know, right? But anyways, and so obviously they're looking into ways. We are looking into ways to increase recycling, decrease our trash tonnage, those sorts of things. And one of the things that came up at the last meeting was a look at our 1 month and 1 day passes and what effect that may be having on our trash tonnage, and maybe thinking about, kind of either getting rid of them or, kind of altering our plan, that sort of thing. So I think hopefully that kind of summarized why you're here, Katie. I did send out in your packet a kind of a breakdown of the costs of the 1 month pass versus revenue taken in the 1 day passes, and I think Katie will probably talk about that a little bit. So I'll turn it over to you.
Yeah, thanks for the time, and it was an interesting conversation. And as the mother of a 13-year-old, I'm really happy that hopefully school will reopen more soon.
All right, your name and address for Paula.
And Katie Curtin Mestre, 26 Linda Street. So I have some slides to share.
Go ahead.
You guys hopefully can see my screen.
Yes.
Okay, waiting for it to pop up. It's not showing it. Wait.
We're seeing it. Transfer station proposal day.
Oh, okay. It doesn't work the same as Teams, so I wasn't sure I was working. Okay. All right. So first, as Steve mentioned, we have seen a pretty dramatic increase in day and monthly passes, which is increasing our expenses as a town for waste. So you can see here that day passes increased from 61 in 2019 to 177 in 2020. And that is a 3x increase. And then we saw that monthly passes actually increased almost fivefold from 21 in 2019 to 99 in 2020. I did a modeling of how much this might have increased our waste bill. And on the high end of the range, that could have resulted in 27.3K of additional expenses. And that is including the money that is already subtracting off for the money that we take in, for the day and monthly passes. And I modeled the low end of that at half of the amount. I mean, it's what you choose, to assume about how much trash people are bringing. So you can see here the assumptions on the high end of the range is that a daily pass person could be bringing in 1,250 pounds of waste. Somebody over the course of a month could be bringing 5,000 pounds. Where these numbers come from are from a rental of a 15-yard kind of container. Again, if you don't like those numbers, just half those numbers or a quarter of those numbers, but it would be fair to say that it's costing us more money to have this dramatic increase in day and monthly passes. So the other thing that I think is important to understand is that day and monthly passes are not common by any means. So I did some research on this. I did research the 12 towns that apparently Westborough benchmarks itself against. Keep in mind that most of these towns don't have a transfer station, therefore it's not a true compare. But the two towns that are in the comparison set, Southborough and Sudbury, those are on kind of the towns we compare ourselves to. Southborough charges $250 for transfer station per year. They do not have a day or monthly option. Sudbury charges $170 for a transfer station per year. And on top of that, it's pay as you throw. They don't offer day or monthly option. Groton was recently highlighted as a transfer station that was doing it right by the DEP. So I checked them out. They're not on our list of towns. They're charging $60 for the transfer station per year and pay as you throw, no day or monthly option. So I think if we weren't going to offer a day or monthly option, we would not be like acting out of turn with what is common. So the recommendation would be discontinue the day, discontinue the monthly pass option, deliver cost savings to the town, reduce our waste bill. Given that we have a 2-year transfer station sticker and a lot of other places have the a year sticker, offer a 3-month pass option, which is really a fair alternative to any residents who are purchasing mid-cycle. Because even if you're at the tail end of the cycle, it's really only 3 months. So that is it in a nutshell. Just want to keep it short and sweet, and then we could jump into conversation.
Thank you, Katie. Any questions for Katie?
I guess, oh, go ahead, Syed.
No, you go ahead, Dr. Walsh.
No, I'm just kind of thinking through that there's kind of 2 different types of people that might be, probably a lot more than that, but 2 main types that I want to divide it between that might have like a day pass. And that would be somebody that just has extra trash for whatever reason that they want to bring out. And something like that would not be even comparable to, 1,000 pounds of trash that they would just put in their car. It would be a couple extra barrels. The other side would be like somebody that has just remodeled their house and has like tons of debris that's probably construction debris that shouldn't be going over the wall, but they're going to try to sneak it in with a 1-day pass.
Well, they don't even have to sneak it in. I've spent enough time at the transfer station to know that it's a kind of anything goes kind of place. So you don't have to sneak in anything. You just have to pull up and throw it out.
Those would be 2 very different kind of categories of people, right? One that has like, heavy cement blocks that they're, throwing over the wall, and other people that just have like regular household trash. And so I kind of want to make sure that we're making policies that are good policies for all around, rather than, just to try to limit one group, we're going to, strip something away from another group that it might be really useful for.
Steve, do you have, Katie presented data for 2019 and 2020, but I'd be curious about 2018 data.
So that we just updated our computer system. So that stuff before then, believe it or not, we just had like paper passes and we took a copy.
The problem is that because we operate on a 2-year cycle, you sort of have to have, you have to compare yourself to 2 years ago, not to 1 year ago, because the behavior is different at different places within the cycle.
Well, for the 1-day passes, I don't think it would change too much the cycle. I mean, we get people coming in all the time. And even for the 1 month, I don't know how much that would really have to do with the cycle. A lot of times people that want the 1-day pass, many of them have like a mattress or a box spring, and I'm sure they have other stuff too, or a piece of furniture or something like that. Of course, they don't have to tell us everything they're bringing down, but we do ask when they call, because we want to make sure that, they're not taking stuff that they can't, and then they get there and they may be turned away. The other thing to consider, and I know, this isn't an excuse, but this is bad year for trash. Everybody is throwing, our numbers are way up compared to last year. And, it's just an odd year for trash altogether as far as with COVID and things like that. So it doesn't surprise me that we've had more passes this year, but will that continue in the future? I don't know.
Yeah, I mean, I just kind of think philosophically, I just kind of think philosophically, we as a town should not be, basically we're subsidizing anything that people want to throw away. And what we're doing is not standard to other towns on any level. So I think if we are serious about reducing waste in Westborough and hopefully reducing the amount of money that we're spending on waste so that we can put the money, somewhere else, this to me does not seem to be like an unreasonable proposal, on any level.
So, Katie, the problem is it's not clear at all that this will reduce waste whatsoever. What it may do, okay, I mean, you can make an argument that will generate more revenue, okay, because we'll get a 3-month pass instead of a day or a month pass, and we'll charge more for 3 months than for a day or a month. But neither of those things affect the amount of waste that the residents of Westborough are going to dispose of. In other words,
yeah, but at least it's not on the town of Westborough's dime.
So
well, it is.
When we've tried to generate fees and decide what fee to charge, we've been moving in the direction of trying to have the cost of the dump stickers balance out what we're spending. And have we reached that goal where we're pretty close to having it support itself, or are we really far away from that? Because that's how much is on the town versus how much of it is on the residents who are buying stickers.
Well, I mean, we always try to have the sticker costs cover the operation of the transfer station, and then the final disposal cost is covered by the tax basis, right? So in addition to that, so I think, to give you a little bit of history about why the price structure for this is what it is that, hey, if you did the math, $5 a day, if you bought a day pass every day, you'd be well above what the cost of a dump sticker would be in a year. And even with, $20 a month, if you did that over a period of 12 months, you're going to be almost double what the cost of a dump sticker is. Not to say that actually covers the cost of the people throwing the stuff out, but that's kind of, I think, what the, at least in the past, how we came to the conclusion of what we would charge.
I mean, you're right about that, Steve. We didn't want to have a situation where someone could just buy monthly passes and save money. It was designed to be a convenience for people in specific circumstances. So we could certainly look at the fee structure. Steve, do you know when the last time we adjusted the fees of the day and monthly passes was? It's not that long ago.
Well, I don't think we've done the day pass in a while, but I think we did bump up the monthly pass, I believe, in recent history. I'd have to go back, but it hasn't been real,
I think we do have language that we weren't supposed to give out day passes more than like 3 times in a year or something like that. I forget what the exact rules were, but there are some limits at how often they can use, a day pass type of thing. But that's like, if my daughter borrows the car for the weekend and that's the one that has the dump sticker on it, and I have to go to the dump and I need to get a pass for the day so that I can bring my dump in with a car that doesn't have a sticker. That's kind of the one day sticker type of thing that people here in town would use, because otherwise what would happen is I wouldn't be able to bring any of my trash to the dump
that week. Yeah, whatever. Yeah.
Or if someone that needs to get rid of like I said, it's a lot of mattresses on the 1 day passes, right? You got a mattress, you got a box spring, you got to bring those down. That seems to be the biggest thing with the 1 days.
We could consider raising the price of the 1 days. I'm not sure I feel comfortable getting rid of the 1 day pass.
I mean, I think the other thing to consider is that Holyoke, which I didn't list on here because they have a curbside program. They have a curbside program, and South Hadley. South Hadley has a curbside program, and they have a $120 fee if you want to go to the recycle center. They have suspended day passes. I mean, I just really think during these times that we're in with budgets being tight, I just don't think it's fiscally responsible for us to continue to offer this when it's costing the town some significant amount of money. And we have tight finances on account of probably less tax revenue coming in. It seems to me it's like it's not an unreasonable thing to consider. And also keep in mind that what we're doing is not standard by any means.
So
you're raising two separate issues. One is, Westborough has a different system than other towns, okay? And then the other is about, is it costing the town money or not? And I think that's where there's some uncertainty based on what Steve is reporting about what people call up with and our own experiences in terms of, when I see people at the transfer station, even people who have a pickup truck, they're not unloading 500 pounds of stuff. It just doesn't happen.
Yeah, but if you take my numbers, if you think the top end of my numbers are high, if you think 27.3 is high, then cut that by
I don't think you can. I don't think you can do that, Katie.
That's $6K more that is costing the town. It costs the town more than $5 for the amount of trash that people are bringing in for the day.
So you have to, you have to first of all show that what they're bringing in wouldn't wind up in our waste stream anyhow. Okay, if it's going to end up in our waste stream anyhow, then we're paying for it one way or the other. And all we're doing by having a day pass is collecting extra revenue.
If they didn't have a day pass, then how would they exactly be bringing it?
Okay, so let's say there's no day pass, there's no monthly pass. So they, first of all, they could, if they have Tidy Town picks it up, it winds up in our trash stream. They have to get rid of their trash somehow. So if they don't have a dump sticker, presumably they're using Tidy Town.
Well, I would say let's get rid of the day and the month pass and see if it makes a difference.
I'm just curious, why can't we try? I'm just trying to understand what's the harm in trying Katie's suggestion?
Well, it affects a lot of people that, like, I only have one dump sticker. And so if that car is not going to be around, then I can't take anything to the transfer station to dispose of it that week. So I would need a one-day pass for that. Right? And I'm sure there's other people that have other situations that might be slightly different. If you move to the situation where, like, I could get a dump sticker on every one of my cars and it costs more to do that than just getting the day passes. But that's what I'd be forced to do if we were to get rid of the 1 month or the day pass. And of course you can't buy them mid-cycle after you've already bought one without then paying full price the way we have it set up. So kind of implementing that change is actually a significant cost to those people that might use that.
Good point, Nathan. Good point.
Yeah, I mean, I really honestly have to say, I just really gonna speak frankly, I just really don't know if we have any appetite in this town to change any waste management practice of ours on any level. I mean, if we just want to continue business as usual, I'm not even sure why we have a waste management task force, honestly. I mean, this is obviously increasing our trash, our bill, most likely. It's
that's not
standard,
obvious.
and we're not willing to change.
We are willing to change, but we want to be data driven. And you're making assumptions that this is increasing our costs that we don't. It's not as obvious to me as it is to you. That's the problem. Because again, where is the trash and waste? How it's got to go somewhere.
Well, I'll tell you, probably the people who are availing themselves of these day and monthly passes, some of them would have rented a bin, but this is a cheaper alternative, so they're doing this instead.
I've rented a bin. What goes in the bin is completely different than what happens when you're taking stuff.
You want to get data, then let's hire someone at the transfer station to inspect what the day and monthly pass people are doing, and then we will have data.
Well, I think that's reasonable. That we can try it. So, Steve, what happens when someone gets a day pass? Do they show it? Is that how do they?
Typically, we tell them to put it in the dashboard, and so that's visible. And if they're approached by the attendant, show it to them. So she's pretty good at picking those out as people come in. I mean, so.
I think it's fair to potentially have some kind of, see if there's some way to talk with her or Jose, who's also there, and get some feedback from them on what's happening with these day passes.
I don't think they're going to tell you. They don't really look very closely at what anybody is doing there.
I don't agree with that.
I'm still seeing people that show up without stickers on their car, and so whether they have a day pass or not, I'm not positive with. But I think that a lot of those go unchallenged by the attendant, and so maybe the attendant is seeing it in the window, and I don't realize the attendant has. But I do think that there's a fair bit that might be going on. Now, as far as spreading resources to have someone down there checking, Board of Health, we are stretched thin in terms of personnel right now. I think that if we had more personnel, that's something that we could think about doing. In terms of, paying for it, in order to have someone inspecting stuff, we'd have to charge a lot more in order to, be covering that cost.
I just really think a 3-month pass option is not gonna break the bank. It's really not gonna break the bank. It's not really asking for too much. And consider that other towns don't offer a day or a monthly option. So I mean, a 3-month option it's not an unreasonable option. You need another pass, buy a 3-month one.
So let's separate out the issues, right? There's the 1 day, there's the 1 month, and then there's whether we need a 3-month and get rid of some of the other ones. And so the difference between a 1 month and a 3 month, I think that most people that are coming into town, whether they're a new resident or something like that, to offer the 3 month rather than the 1 month, I don't have very strong feelings on. If the 3 month is what's preferable for us, I'm not against that. There are definitely cases where having a 1 day pass has some merit, that unless we address that, we'll have situations that come up that just become very bizarre situations. And so if it turns out that a lot of people are using it to get rid of a mattress, that mattress right now, we're using the grant to dispose of the mattresses, right? So that doesn't, we're not anymore?
That was discontinued with COVID. So we're paying for them now. Okay. That all in last March.
But I do agree that maybe the $5 fee for the day pass does not cover the cost of what a typical person with a 1 day pass is disposing of. And so I'm definitely amenable to increasing that price. And I'm also amenable to thinking about moving the 1 month to a 3 month instead. I don't know, Alan, what you and Syed are thinking, but I would really be opposed to just getting rid of the 1 day.
Syed, do you have any response or thoughts that you want to share?
Sorry, Nathan cut out. Could he please repeat the last sentence of what he said?
That I'm against getting rid of the 1 day. I am in favor of increasing the price of the 1 day, and that moving between a 1 month and a 3 month option, I don't have very strong feelings on.
Katie, what are your thoughts about increasing the price of the 1 day? How would that factor?
I mean, I think it's a reasonable option. If we had a 1 day, and then, as I understand it, the reason that we have the monthly option is to account for the folks who are mid-cycle. I mean, that's kind of the logic for the monthly. So I think if the monthly were 3 months, again, nobody is ever out for more than 3 months, which doesn't seem to me to be unreasonable. And then we raise the cost of the daily. Let's just say my numbers of how much you threw away for the day were on the high side, but let's just say that you did throw away, 1/4 of a ton for sake of argument, right? I mean, we would want to be at $27.50, we would be breaking even. Yeah, so
So-
I think that seems like a reasonable option. Raise the price of the day one.
Katie, your 1/4 of a ton is the absolute upper limit. That's
But
not
we
the
have no
lower limit.
data.
Okay, but I drive a car. Okay, I don't put 500 pounds into my car and then have to physically unload 500 pounds worth of stuff. That's just physically not plausible. I mean, anyone else on the call, if you think otherwise, chime in. But 500 pounds.
Okay, but even if someone did 200 pounds, that's $13.75. I would venture to guess that in most cases, $5 is not covering what people are throwing away.
We're not arguing whether we can. Again, first of all, when you're quoting those prices, you're quoting the cost of transferring the materials to wheelabrator and disposal there, which again is separate from, is that actually increasing the cost of the town? I'm not opposed to saying it's been $5 for a while, we can make it $10. Okay, I don't have a problem with that. $10 probably covers the vast majority of things, and it's a minor disincentive to people, but it's not a huge burden. But I do think you have to be realistic when you're suggesting how much someone's going to throw away on a day pass. Is you know, if we're going to have a discussion around that, the numbers have to be realistic.
I just don't really think right now we have any idea. We don't know what people are doing with the day pass, but I mean, I think raising it more than $5 seems reasonable. I mean, I don't even think $20, honestly speaking, for a day pass is unreasonable.
Yeah, I mean, I'm more inclined to look at the $15 to $20 range for the day pass as well. I mean, for me, that sort of inconvenience of keeping my trash for an extra week or not, easily comes down to do I think it's worth the effort of going to get the day pass and paying the fee, and frankly, that's kind of the calculus that's going on in my head is how much is it worth? Is it worth it or not? If we can driving people to wait the extra week to get it on their regular month 2-year pass doesn't change anything about the cost of the town. All it does is inconvenience residents because they decide they just have to it's not worth getting the day pass. For those people that are doing construction but don't have a pass, that might be tossing lots of stuff out, or a mattress, or like they cleaned out their parents' house and so they've got tons of stuff that they want to get rid of. Those are the cases that I think you're right that they could have a lot of stuff. But as Alan pointed out, what you fit in a car, I mean, what I can fit in a car is closer to what Alan is saying, where even if I had 3 large trash barrels, in my car is pretty full at that point. And that's certainly not going to come out to, 500 pounds. I mean, I'd be lucky if I can get, 50 pounds into a trash can. And these days it's actually much lighter.
Can I ask something to Steve or to our staff? Is it so I recognize you have to come in person to get the thing. Is there any way that you can pay by credit card and just print up something? Because just to make life easier for you, is that possible?
Well, I mean, look, people have to. That's the other thing. We don't do passes over online, so people do have to. So it's one more barrier to people really got to want them to come in. We don't offer credit card payment for the passes. We just do cash or check here in the office.
Okay.
Yeah, I don't think it would be a good idea to do online. We are worried enough about people who are not Westborough residents disposing of trash.
Yeah,
And
sorry.
Yeah.
Yes. Okay. Yep. Sorry. Yep. My bad.
that's okay.
Yeah, so
Okay.
let's discussion
Go
about,
ahead, Nathan.
I would say let's kind of focus in. Let's first focus on the one day and try to make a motion if we want to change it from our $5 to something else. Do you have, Alan, a price that you were thinking? I mean, I think you had suggested 10. I thought that was still a little low.
I just think it's it's a 100% increase. So I could go as high as 15. I don't think I want to go from 5 to 20 in one go. I think that's.
Let's go with 15 then. Let's go with 15.
Somebody want to make a motion? What's that?
was asking Syed to make that motion.
Okay. I move that we increase the price of a one-day pass to $15.
Okay, I'll second that.
Effective when?
Effective
How about March 1st?
March
or-
1st. Good idea. Good idea.
The only thing I would, sorry to interrupt, that throw in here, I believe that fee increases have to be approved by the Board of Selectmen.
Fine.
So,
That's
So,
it's your problem, Syed.
so we'll have to get on the agenda. So whatever, so as far as effective date, I don't know how quickly we can get on their agenda, so it might not be March 1st. If you throw out a date like middle of March, that'd probably be.
Why don't we not have a date on the motion
Yeah,
then?
I don't think. Yeah.
Okay.
Effective.
All right.
The 15th, and then we have somebody get the Board of Selectmen to approve it, and they put a date stamp on it.
That sounds fine to me.
Okay.
Right.
All right, so we'll do a roll call. Dr. Hashmi,
Yes.
Dr. Walsh,
Walsh, yes.
Dr. Ehrlich, yes. All right, that's step one.
Yep. So now the other part was the 1 month versus the 3 month or no kind of longer, mid-range.
What do we charge for the 1 month pass right now? Is it 20?
20, correct.
Yeah. So obviously now that the day pass is 15, we're going to encourage people to just get a 1 month if it's at 20.
Yeah, I mean, if the 1 month is now 3 months and the 3 months is, I guess if you say 20 times 3, that would be logical, right? It's 60. I mean, that still seems reasonable relative to the cost for the 2 years, right?
Yeah. Well, it's not reasonable compared to the cost of 2 years. It's just less. It's
Yeah.
more on a prorated basis. But yeah, it's you're not spending the full 2 years worth. Do we sell 1 year if it's after the thing, and that's a
Correct.
half? So
July
1 year.
1st. Yeah.
So
July
1
1st.
year is 120, right? Okay, and we're saying 3 months is 60.
That seems pretty reasonable. Yeah.
All right, I can live with that.
So this would be then moving the 1 month to a 3 month and charging $60 for it.
Yep. Or you can pay $15 each 1 day, up to 3.
Yeah, I make a motion that we do that with the same criteria, that because this is a change in fees, that it has to be approved by the Board of Selectmen, so that we send it to the selectmen and they vote on it and have a day added for when it becomes effective.
So would they vote on it this month or would they vote on it in March?
We have no control over the Board of Selectmen, but Dr. Hashmi has some control.
Oh, okay.
What will have to happen, Katie, is I'll have to request to be put on the next meeting. I think they already posted theirs for next week. I think I saw
Okay.
that. I just have to figure all that out, but we'll get on the next one we can. Oh, Paula?
Can I just clarify that last motion for the, no longer, we're not going to have a 1 month anymore. It's going to be a 3 month.
Yes.
And what was the cost going to be?
60.
60. Okay.
So same as the 1 month, just it's
Just times 3.
Times 3. Yep.
Yep.
Obviously, if the selectmen don't approve it, then we would continue to still offer the 1 month.
Yes.
Do the selectmen vote on each of these in turn, or do they vote on them separately? Because, like they kind of go in tandem, because if not, it's kind of wonky.
Yeah, I don't know. We've never gone before them. I mean, we don't change stuff that often. So the last time I went before them was for a fee schedule, and they just kind of voted on it all together.
Okay.
But
Yeah. I'll make a motion that we request the Board of Selectmen to either approve both fee changes or no fee changes.
Yeah,
I'll
yeah, I
second
agree, Dr. Ehrlich, because if one without the other is it's not gonna seem like logical to the residents.
I'll second your motion, Dr. Ehrlich.
Okay, roll call. Dr. Walsh,
Walsh, yes.
Dr. Hashmi,
Yes.
Dr. Ehrlich, yes. Okay. Anything else, Katie?
Nope. Thank you.
Thank you for your time.
Thank you. You might sometimes feel frustrated that we don't move fast or take up all the recommendations put to us, but we do kind of weigh in, not just balancing the trash and the recycling and trying to limit our costs, but we do have, residents that we're responsible to. And so we're trying to find that happy balance. And so I encourage you to keep pushing us on issues and not to give up, and to, keep bringing before us, issues where we can change, and, different things we should look at. So thank you.
Yeah, I just had a question. I had the list of like the towns that Westborough benchmarks itself against. I got from Pete Dumbeck. Are there any
Who is
towns,
Pete Dumbeck?
Sustainable Westborough?
I don't know him. I'm sorry.
But anyway, the list of towns is not from him. The list of towns is from somebody in the town leadership. But anyway, the list of towns that we look at for the town, that the town looks at, most of them don't have a transfer station except two of the towns, which is, Southborough and Sudbury. Are there any towns, because we got like obviously more kind of strategic proposals that we're going to bring forward. Are there any towns that you guys really think we should look at anytime we come with analysis that are important to benchmark ourselves against?
So go ahead, Steve.
No, I was just saying, I mean, Irene knows the towns that have in Central Mass that have transfer stations, not even so much in Central Mass, but I think, obviously those are in my opinion, those would be who you would benchmark against. If, and really there's probably nobody that has the same setup that we have. We're somewhat unique, I think, in the way we do our trash. But if you can get close as possible to anybody, that'd be good. I don't know, I feel the same way.
Yeah, again, we don't have a list of towns that we look to say, well, how are they doing it, and what are we doing? When particular issues come up, we look at the specifics of that issue. So when we decided to stop accepting construction and demolition materials, we look at one set of things. When we're looking at pay as you throw, obviously we look at towns that pay as you throw. So, it depends upon the issue in question.
Okay, all right. I'll try to, well, it'll always be the issue in question. But I think to Steve's point, and any town that has a transfer station is probably a better compare than a town that is pure curbside. That's why I thought Southborough and Sudbury were interesting. But anyway, thank you for the time. And I really want to thank you guys for at least considering these options. I know you have a lot on your plate with COVID, and I appreciate your time. So thank you very much.
Okay.
Yeah.
Bye-bye.
Bye.
All right.
My goodness, this is becoming a Board of Selectmen meeting.
Yeah. All right. Mask usage discussion.
It must be 45.
Yeah. This relates obviously into the director's issues, but my concern is really with the amount of contact tracing we have to do, all the other activities the Board of Health has to do, and being severely understaffed. I don't feel like tracking down mask complaints is a high enough priority to warrant a lot of time. I don't mind you making a phone call, Ray, for instance, but going out and paying a visit every time somebody sees somebody without a mask, I think, what I want is to have the board's endorsement to encourage what I will call a selective enforcement based on judgment of the staff, that not every complaint needs to be tracked down. Some of these have to be prioritized against other things that our staff has to do during this pandemic.
I'll second that, Dr. Ehrlich.
I've got a question. Is there a difference between, let's say, employees that are not wearing masks or having mask issue complaints versus like customers having mask issue complaints, right? Meaning that, like, if you happen to see somebody in the parking lot that's not wearing a mask and it's just somebody that's visiting that business versus somebody who owns or works at the business that's not wearing the mask, do we want different levels of enforcement for that? Or do you want to just have it all just be, low priority?
Well, what I'm saying is, all right, you get and I don't want to pick on any business in town, so I'm just going to say you have business X, okay? And somebody calls up and says, I was in there and some of the employees were not wearing the masks or not wearing them appropriately, whatever. What happens often is, someone like Ray will go down and take a look and see, are people wearing it, validating the complaint. And I'm suggesting that maybe he just picks up the phone and says, hey, we got a complaint. Can you please make sure people wear the mask, and let it go at that, as opposed to spending time traveling around and doing the inspection and seeing for themselves. Now, if you get a situation where you've got 4 or 5 complaints in short order, okay, maybe you have a problem, and that's when it warrants an in-person visit or something like that. And again, I'm trying to create a system where the staff uses judgment as to what level of intervention is necessary. But this has to be balanced against all the other things that they have to do. And with the inadequate staffing that we're going to be experiencing for some time to come, I think we have to make tough decisions.
Yeah, I can be on board with that. And so that's an official motion that you made, Alan?
I will make it. I move that the staff use their judgment when it comes to investigating mask-related complaints, and that phone resolution is adequate for the vast majority of these incidents. Ray, you got any thoughts about this? You're on mute.
No.
I
No
mean,
thought. No, I understand what Dr. Walsh was saying about employees versus others, and that's when I call. Those are the ones I make the calls on, is when I get the employees, because then I can call the manager and say, hey, look, I got a comment on this. At least with Toyota, he'll look at the video and he'll call me back and say, Ray, yep, I found out who it was or something. Another time he called me and said, Ray, it was actually not a staff member. It was actually a customer. So he's very good at doing that for me. And a couple other places are good. I can call them and they handle it. So I don't see us having to go out. But yeah, as the months are rolling in, we got a lot more mandates that are coming up. So we're going to be getting hit hard again, probably in the middle of March. And at that point, we'll have a 3-person, we'll still have a 3-person office, and we'll be trying to train and do all that stuff at the same time.
Okay. I would second this if we could put some sort of time constraint on there, and we can always reevaluate it in like
Sure.
6 months or something like that. Would you be
I'm
comfortable?
willing to go 3 months. Let's wait till we're fully staffed again, and we can see what the contact tracing looks like.
Okay.
Because again, I think contact tracing has more actual impact on the spread of the pandemic than than casual exposure to someone who's unmasked.
Yeah, I'll second that motion then.
Okay. Any further discussion? Roll call. Dr. Hashmi,
Yes.
Dr. Walsh,
Walsh, yes.
Dr. Ehrlich, yes. All right. So we have now general COVID discussions. Are there other things that I can't even remember from the beginning of this meeting? It sounded like something we were going to be pushing. Vaccinations and all that stuff. Go ahead, Dr. Hashmi.
No. I just want, Steve, any update on the vaccines? Did we get any? Are we going to get any?
So, in general, it looks like the state is is pushing this model of moving towards more regional approaches, or the bigger sites where you have more throughput as far as those sites getting the vaccine. So just giving you an idea, we've asked for vaccine the last 2 or 3 weeks, haven't gotten any new doses. We get the doses for our second round of people that we have to vaccinate again, but first round doses are slim, not coming. We've also been included in a collaborative with Hopkinton, which I could talk about for about an hour and a half.
Not without curse words, you can't.
Yeah, and we may be able to get doses through that, but they didn't even get any new ones this week. So that collaborative allows us to send people to Hopkinton, which I think we did, reference that last week. But it looks like right now there's just limited doses. We've been told the state gets about 100,000 a week, and the demand is much, much higher, right? So people just got to kind of hold on, or if they have the opportunity to get doses through, I know CVS and Grafton had appointments, or going to the bigger facilities. If you're able to do that, we should probably do that and not wait for us to do it at the local level, because we may not be getting vaccine anytime soon.
So while we have an audience potentially here that is listening, this is a good time to contact your representatives because they're the ones that ultimately put pressure on the Baker administration to change their policies. We have infrastructure set up here where we could distribute vaccines in a way that doesn't require our residents to have to travel to like Foxborough or some mass vaccination site. And so I'm disappointed with the state government in not rolling this out. And I kind of want to use this as a platform to talk to the residents to say, we are doing everything we can. We just aren't getting the vaccines from the state.
So, yeah, there are things we could do to get that would increase our chances of getting the vaccine. They come with problems. Okay, so one thing we could do would be to open our site to anyone. Okay, right now we are primarily dealing with people just from Westborough. Not exclusively, we have vaccinated people from other places, but we're not open to anyone for what we're trying to do at this phase. We could also partner with somebody like Northborough, and then we'd have higher numbers and higher throughput. Again, now you're dealing with having to work with another town and their logistics and things like that. So, your suggestion about contacting and representatives and trying to get the administration to be more flexible, I think is reasonable. Their goal, I will say, is to get vaccine out and into people as quickly as possible. So they're a little nervous about towns being parochial and only looking after their own. I just want to share sort of their perspective. Steve, did I leave anything out?
No, I think that's a good summary.
Okay.
So we ask
All
for
right.
it. If we have it, we'll have the clinics, but people really should, if they have the opportunity to get it somewhere else, please take advantage of that.
All right. I think we're now up to director's issues. What would you like
Did
to
we do
start
the
with,
Senate-
Steve? Oh, sorry, what's that? Nathan?
Did we do the sanitarians report?
Did we do the sanitarians report?
You did the sanitarians report, right, Ray? Did
Yeah.
you finish?
They started, but they didn't vote on it. Except
Yeah, you didn't vote. That's what I wanted to
Oh,
say.
I'm sorry. I thought we did. My
No.
apologies. All right. Any more discussion about the sanitarians report?
I move to we accept it.
I'll second.
I second.
Okay. Dr. Hashmi?
Yes.
Dr. Walsh?
Walsh, yes.
Dr. Ehrlich, yes. Okay. Now can we do the director's report? Director's issues?
Sure. So
I'd like to start with number one, please. Go ahead.
So this is no surprise. I've talked to the whole board about this, and it's not really a big surprise to any of you. And you've been tiptoeing around it the whole night. So I there's no other way to say it. I am leaving the Board of Health. I've taken another position with the town's DPW engineering department. It's been a tough year for me mentally, and I just felt that it was time for me to move on. So I've been here almost 24 years, but March 5th will be my last day working for the Board of Health. I will still be in town, so I will be available, obviously, to help whoever takes over. I just want to thank the board, for all the help over the past year. Without the great help from all of you, I certainly wouldn't even have gotten to where I am now. And then also without the help of my staff, Ray, Paula, Aaron, who moved on to. There's really no other way to say that. So, is what it is.
We are very grateful for your years of service. We're proud to have had you as our director. We definitely wish you the best. And so I want to give Syed and Alan a chance to thank you as well, but it has been a pleasure working with you.
I'll let you go next, Syed.
I just I echo what Nathan said. I was new and I came to the Board of Health, so Steve has been a real mentor to me, and I feel devastated. I've been ever since he called me. I was thinking about whether how I wonder if what I could have done or should have done, or I can just imagine the stress that he was under, and I'm grateful for his and the staff service, and I wish there could have been more. I wish we could have made this easier for you, Steve. I guess that's what I wanted to say. But I'm deeply grateful for all your time, your energy, and for your constant education of me. And I would urge that the board, write a letter thanking Steve for his service.
Thanks, Syed, and I certainly concur with that. Obviously, I've worked closely with you, Steve, for a long time before we ever heard of Triple E and before we ever heard of COVID-19. And I certainly have been aware of the stress that you've been under, and I've been grateful for you persevering through all that. I have been very acutely aware how lucky Westborough has been to have you in that role, and I've obviously done whatever I can to support you, and I have heard your thanks and gratitude many times. But it was, trust me, I got much more out of it than you ever did by me being able to have you continue in your role. So just let it go at that. Paula, if it's okay with my fellow board members, I'll work on the congratulatory letter that you can have typed up, and perhaps we'll get something framed for Steve to take with him.
Okay.
We all know how Steve loves hanging things on his wall. He's got that plaque that's been there I don't know how long, sitting on the table. Actually, did you take it home this weekend, Steve?
Yeah, I did.
And then can I just ask Paula, when the letter's ready, please let us know, because I would like to.
Yeah, you'll circulate it, Paula, but unless somebody else wants to take the responsibility of drafting
no,
it.
I trust you, Dr. Ehrlich. You've known him the longest. I just wanted to I'm deeply grateful for his service, and just the amount of work that, especially in the last year, that our staff has done, and just thank you.
Oh, well, thank you.
All right.
One of the things related to that is that as we go to look for another director of our Board of Health, and in light of how many of our employees are working nights and weekends and multiple days that in a row, and how hard it is for them to be able to take a vacation and enjoy their vacation without stressing out about this, I'm thinking that one person to fill Steve is not enough. I'm actually thinking that we need to seriously. I think that we need to actually get two more people for the Board of Health than just replacing one. And so, because that would be a new position, I think that we would have to make a motion that we requisition that, and that then it can be sent to the Board of Selectmen, I think, to then be put on the town meeting agenda. But I think we need it, and I think that we do a disservice to all of our employees that are struggling and working so hard to try to meet all the demands we put on them.
Yeah.
Kind of work is sufficient for an extra headcount, I think.
Yeah. So I don't disagree in principle with your thought process. And there's actually some support for it within the town, which I'll get to in a second. But we can't just request two people to replace Steve. That's not going to fly. I mean, just in the way that budgets and towns work. I think what we need to do is we need to define what, we need a director, and we need to define what that other position is. So, for instance, there was a study that looked at the town and how to improve the functioning of the town. Steve, you can probably recall the name of the stuff.
It was a staffing study.
And one of the recommendations from that staffing study was that we have a public health nurse. Okay. And of course, Steve was like, what do we need a public health nurse for? I do everything. Well, if we had a public health nurse, maybe we'd still have Steve. Who knows? But in any event,
I'm an idiot,
But in any event, if we I think we need to just put a little thought into how we want to frame this so that we're successful. Just saying that Steve was overworked and therefore we need 2 people. I think it's better to say, well, what are the things that he did and what type of person would be appropriate to have, in support.
Yeah.
So
Are we the appointing authority for
Okay.
the Board of Health Director?
we are the appointing authority. I will tell you, I've spoken to Christy already. I'll update you on that conversation in a second, but go ahead, Nathan. You had a question?
I was just going to wonder if we could do an analysis of where we're lacking in terms of resources. I'm not super familiar with, Maria's background? And so do we have any looming gaps that we lose in terms of specific areas that we need covered? So as you mentioned, like a public nurse, we don't have anyone like that. Ray's done quite a bit of different types of inspections, but again, I'm not.
Yeah. I think that's a good question, Nathan. Steve, I know you have many certifications. Does Ray have all the certifications you have for the various things?
I have almost all the same. I don't have the CHO, but I have my RS, I have my SE, I have my CPO, I have all those. I have almost all the same ones Steve has. I've been doing a lot of the contact tracing along with Steve. So just to let you guys know, I will not be going for the director's position. I want to stay as a sanitarian for now. I don't think I'm ready for the position, and you guys aren't ready to have me as director. I think I'm a little too outspoken on some things, so I think you guys, and coming from Steve to me would be a big jump. So I think we need to bring somebody else in that can do the job, that I can support. And there are some people out there that have reached out to me about the position, asked if I was going for it, and I said no, and they're going to look into it themselves. So, and I think you're right. I think we do need a public health nurse. I know they were talking about sharing one with another town, which may help out, but I don't know. That's Steve knows more about it. He's been here 27 years. I've been here 8, so he knows a lot more than I do.
So towards that end,
go ahead.
Yeah, go ahead.
No. I want to hear what you spoke to Christy about.
So when I spoke to Christy, we discussed this. Obviously, she's going to be advertising, and the board is the appointing authority. That being said, what we did the last time was there was a committee that pre-screened the applications, and it includes people that the health director has to work with, such as the fire chief and the building inspector and whatnot. So she was going to put together a group. This should obviously have a representative from the Board of Health on it. I'm happy to be that representative if that's what the board wants.
I nominate you.
I mean, Nathan, I don't know if you are interested in that position. I have probably more free time during the day than you do, is my only thought.
I am busy and want to make sure that any time I put in somewhere is maximizing that usage. And so this might not be an area where I'm maximizing my usage.
I mean, the reality is you're going to still interview the person or persons who are up there. So it's really just that screening capacity. So again, I'm happy to fulfill that role.
Also
But
happy.
Dr. Ehrlich, before we do that, can we, as a board, and today is not the day, I think I recognize they're advertising, but I think the discussion, we still need to have a discussion of what we are looking for, because whoever we bring on next, in a sense, will have to build from what Steve has, the foundation that essentially Steve has laid. So I think we need, as a board, to have a discussion of what are we looking for in the next director? And I think this discussion of what are we, and this needs to marry with our goals and so on.
Yeah. So unfortunately, it's 8:30. I think, I don't know how quickly this process is going to move. I don't think it's going to move that quickly. And so I would suggest we put this as a agenda item for the next board meeting.
Okay.
Again, thinking back on some of the conversations that have taken place over the years, Syed, many of the things that I think you've been interested in advocating for are the kinds of things that I think if we had either a full-time or part-time public health nurse would be someone who would be focusing on some of those more proactive and outreach type stuff. we certainly need a director just managing the nuts and bolts of what the health department has responsibility for, which in this town is much bigger than in quite a number of other towns. So
just to let you know, I've already been tapped. I will be the interim director starting on March 8th until they find someone. I've already been asked by the town manager and assistant town manager to step into that role to help. Steve will be in town. He already told me I could call him if I had an issue, a question or anything like that, but I will be taking over there. So as well as training Maria and working on COVID and everything, I'll also be taking over Steve's duties for the time being.
okay, this is why I don't want him running around inspecting for masks.
Yes.
And this is why I don't want Steve's job.
If we were to, let's say, the public nurse position that we were looking at, would that position be able to do things like go and do, I don't know what we call them, but when we check in on, let's say, somebody who has like a hoarding issue or something like that,
A wellness check or something like that?
Is it something that we could look for somebody that might be willing to do that sort of thing? Something that might broaden outside of just like being a nurse?
I think
too much of an ask.
That's not too much of an ask, I don't think.
No, I don't think so. It's a matter of, doing quote unquote nursing stuff 40 hours a week probably isn't gonna, once we get out of COVID.
Right. That's why I'm looking for some of a few other skill sets. Yeah.
Correct. But they do whatever we would train them to do, and hopefully they'd be willing to do it. That'd be something you'd have to tease out in the interview process.
Yeah.
And then the other question that I have is that very early on in the pandemic, the selectmen raised the issue of whether we considered us in a state of emergency. Is our staffing level dropped to the point where we aren't able to do? No, seriously. I mean, is it dropped to the point where we can't actually do some of our basic functions? I want to make sure that we ask ourselves, what is the point where we would consider ourselves in a public health emergency? And lay that out there, because we might decide that losing Steve and having Ray do 3 different jobs, including training somebody new, puts us at real risk. And to let the community know that we're operating at a less effective point than we would like to be is, I think, an important thing for us to let the community know. I'm not sure we're there yet, and we'll see how it goes. But I want to kind of have that on our radar that maybe we are
that's
close.
Fair.
No, I think to go along. I think Nathan. I agree with Nathan, and I'm just wondering, do we want to be proactive about? I know it's late, but do we want to be proactive that we're transitioning to a new? Do we want to just put something brief out now from the board? I think it's better just to do it now rather than wait.
Well, what exactly are you suggesting we do? Because I don't want to, I don't want to cause a panic.
I know.
I also don't want to create a panic. I mean, I think if the Board of Health of Westborough declares that there's a public health emergency in Westborough, I mean, everyone's going to watch this 5-hour
No, not an emergency. We just need to say that we're transitioning to a new. Oh, good God, I'm not thinking. I can't get the words out.
That's what happens when you get to 8:30 at night. I have a suggestion. It's not aligned with what you, Nathan, are saying directly, but all I'm going to say is maybe we try and do the March meeting on the 2nd Tuesday, not the 3rd, get a little sooner on the calendar because we have these issues that we need to address, at which point we will have an interim director and we will have a new health inspector.
Okay.
Yeah, I want to let Steve and Ray know that if they think that things are unraveling, that we can call an emergency meeting and then we can try to figure out how we address it. And even if it's doing something as large as declaring an emergency or something like that, don't be shy about letting us know how things are going on the ground. Because if we only meet once a month, sometimes things could deteriorate quicker than we would expect.
And I would agree that we can meet on an emergency basis, on short notice, if anything arises. I think that's a very appropriate suggestion.
Good. So I think you are proposing March, did you say 2nd?
No, the second Tuesday in March, which is going to be the 9th.
9th.
Let me just check my calendar while I'm at it.
Yeah, it's the 9th.
No, I mean, like,
Oh, yeah, no, I'm sorry. Just ignore me.
I wasn't doubting you, Paula, not for a moment.
I know.
Yeah, the 9th is fine with me.
It's fine with me as well.
Okay, so that takes us to the last item, but there may be more directors' issues that we glossed over.
No, I don't really have anything else.
It's your last chance, Steve. Come on.
I'm actually impressed with Dr. Terrell that was talking tonight, and I know that Syed was thinking of stepping down at the end of his term, and we're always looking to bring new people on. But I think they were a Westborough resident, and so maybe that's somebody that we reach out to. It's not somebody that I have any personal connection with, and so I wouldn't run across them at any other time.
So, I think that's a fine suggestion. I know there's another doctor in town who's reached out to me, Dr. Marr, who's been watching our last meeting. I think she's watching this evening. And I know Syed knows someone who was interested. So,
Yep.
So I think we'll have some openings. There'll be an appropriate process where we ask people to step up, and hopefully we'll get somebody very, very good.
Excellent.
All right. Anything else?
No, just to thank Steve for his work, and good news. You're not going to have to do this anymore.
Oh.
You beat me out the door, buddy.
Well, he still has to do a few more COVID reports before he's done. So there's that. All right.
Yeah. In terms of the contact tracing, if you had to roughly ballpark, how much are we sending off to the CTC and how much are we doing internally? Is it, 1090, 90-10? Is it?
What do you think it is? 25% internally?
Internally, we're doing about 25%. I'm sending I was going to say 60%, but yeah, I'd say we're probably sending out 75% right now. And when the funding runs out for weekend work, it'll be a lot higher because I'm getting most of my cases coming in on the weekend, and I'm working the weekends. But that grant is going to run out soon enough, and when that runs out, I can't get paid for that time, and it's not worth my time to not get paid. So,
what was it? In terms of percentage, when Aaron was on staff?
We're probably closer to 60% us, 40% CTC.
So I mean,
maybe higher. I think it was even higher than that.
Would have been higher, yeah.
Yeah. So basically, being down one person has made a huge difference in our ability to do contact tracing.
Yeah, it's been we've been out without Aaron for 6 weeks now, and it's getting more and more difficult to get caught up. I have calls I have to get on. We have some businesses opening, so I've been going out and doing inspections. When I get called out on a housing inspection, I had to go out on one the other day. I lost 2 hours to the office. So that's where we're struggling right there.
Yeah. All right. Any other things, or can we have a motion to adjourn?
I have a motion to adjourn then.
I'll second that.
Okay, roll call. Dr. Walsh.
Walsh, yes.
Dr. Hashmi.
Yes, and Dr. Ehrlich and everyone, thank you for your time and patience.
Thank you. Dr. Ehrlich, yes. Goodbye. All right. We'll see everybody on the 9th. Steve, I'll be in touch.
Thank you.
Yep.
Yes.